दिल में प्यार जीना इसी का नाम है। किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार जीना इसी का नाम है। जिंदगी एक सफर है सुहाना, यहाँ कल क्या हो किसने जाना। जिंदगी एक सफर है सुहाना, यहाँ कल क्या हो किसने जाना। जिंदगी एक सफर है सुहाना, चांद तारों से चलना है आगे, आसमानों से बढ़ना है आगे। चांद तारों से चलना है आगे, आसमानों से बढ़ना है आगे। पीछे रह जाएगा ये जमाना, यहाँ कल क्या हो किसने जाना। आने वाला जिंदगी बिता दो पल जो ये जाने वाला है।
Do you know you're my mama? You do? A while ago you said you didn't know you're my mama.
Well, you act like my mama.
I act like your mama?
Mm-hmm.
I'm saying you're my mama.
I'm your mama.
Yeah. All right, I'll be your mama. Now, do you think that I would lay here with just anybody?
No. I think you want to have to love them if they want to.
Yeah, you do have to love them to lay down with yourself.
Yeah.
And I love you.
I love you.
But do you know who I am though?
Uh-huh.
Who?
Kelly.
Yes, Mama. Yes, I am Kelly.
Well, I love Kelly. And then I
साथ साथ चलते चलते हाथ छूट जाएंगे, ऐसी राहों में मिलो ना। बातें बातें करते करते रात कट जाएगी, ऐसी रातों में मिलो ना। किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार जीना इसी का नाम है। किसी की मुस्कुराहटों पे हो निसार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार जीना इसी का नाम है।
You may share the same memories from your youth time and time again, but the sheer joy you show in telling those stories with such a big smile on your face goes beyond making up for the loss of new memories, as said by Rene Fry.
As a society, we push towards the fulfillment of each group, whether it is the education of children or the empowerment of social groups. However, it is often that the strange of a certain population goes largely unnoticed.
Our knowledge of dementia is fairly reclusive within a certain lens. The dementia cognizance, while common amongst us, lacks the depth of social understanding. Good morning to one and all present here. I, Prerna Singh,
And I, Ridhanta Kota, are your host for today's seminar. Through this seminar, we aim to be the portal through which we encourage education, awareness, and inspiration on the account of World Alzheimer's Month. We are here today with students from Mumbai University, MD Shah Mahila College, Wala Foundation, Thakur Ramnarayan College of Arts and Commerce, Patkar College, and our very own RD National College psychology students, without whom no program can be a success. The multitude of stigmas associated with mental illness takes a tremendous toll on the elderly population. In reality, many elderly people hide their issues with mental illness because they believe it to be a sign of weakness, which is made worse by the insufficient availability of services and lack of access to necessary resources.
There is a remarkably low number of mental health professionals with specialized training in caring for older individuals, and many of them have the preconception that they picked up from society.
Older individuals are significantly impacted by mental health issues, which can lower their independence and quality of life. Making a diagnosis is the first step in reducing these detrimental effects. Since mental health conditions are commonly misunderstood and left untreated, too many older individuals continue to struggle without receiving the appropriate assistance or any care at all.
Mental diseases may worsen symptoms and functional limitations brought on by medical conditions, increasing the need for medical resources, duration of hospital stays, and total cost of care.
We welcome you to the Intercollegiate Seminar of the batch 2022 to 23 that is hosted by the Department of Psychology, which was established in the year 1949 and is under the current guidance of Dr. Meghna Bhasu Thakur at RD National and SWA Science College in collaboration with Regional Resource and Training Center and the Center for the Study of Social Change, D'Souza Foundation, and Alzheimer's and Related Disorders Society of India. Meghna ma'am has consistently encouraged us to speak out about important social concerns, and her encouragement has helped us to broaden our worldview, molding us into the psychology students that we are today.
Our department focuses a strong emphasis on the holistic and ongoing development of the students. And to that end, we provide seminars, webinars, and workshops that are all tailored to current themes and problems affecting people.
September is observed as World Alzheimer's Month. Each September, people gather together from all over the world to spread awareness and combat the stigma that surrounds dementia in general and Alzheimer's disease in particular.
This serves as a chance to demystify dementia, educate others about it, and promote their support. Therefore, as part of World Alzheimer's Month, we are celebrating World Alzheimer's Day, which is observed on September 21st. To overcome the earlier stated goals and stigmas, we as students of Department of Psychology hope to contribute to this cause by organizing this seminar, spreading awareness about the same, and opening conversations towards the cause.
We are extremely honored to have several esteemed speakers here with us today on our panel. Each of our speakers have made significant and monumental contributions to the cause. They all take into account the fortitude and symbolize the resilience we require to push through this hurdle.
Before we commence, we would like to thank our principal, Dr. Neha Jagtiani, who has relentlessly supported our departmental activities and encouraged us to keep us on such events.
We now would like to begin our seminar by introducing our chief guest, Dr. Urvashi Shah, who is a consultant at Global Hospital, Parel, Mumbai. She has 30 years of specialization in the field of neurology. Dr. Urvashi is a member of numerous associations like Bombay Psychological Association, the International Neuropsychological Society, World Federation of Neurorehabilitation, to name a few. She is the recipient of the Mayor's Achievement Award in recognition of her pioneering neuropsychology services in Mumbai, the Award of Excellence in recognition of setting up the first services of neuropsychology in a state government hospital for the underprivileged, and the Matthew Fellowship at the 27th International Neuropsychological Society Conference for setting up the first neurorehabilitation services for traumatic brain injury patients.
We now invite Dr. Urvashi Shah. It is our honor to have you with us this morning, ma'am. Thank you so much for taking time out of your schedule and making time for us. You are now welcome to take the stage and educate us.
Okay, so good morning, everybody. And I must say, it's a real pleasure to be here today and see all of you all. We're going to talk about geriatrics, we're going to talk about older people. It's wonderful to see young faces and happy, smiling faces. I hope there'll be happy, smiling faces. The reason I'm saying this is, and why I agreed to do this in the early morning like this on a working day, is because as psychology students, I was just telling Dr. Meghna that you are the future, and especially for this condition. I'm speaking professionally to you that there's going to be a huge space in the very near future where all of you will be required. So professionally, it's a great career opportunity. I've tried to sell it and market it to you at the first level. And then we'll talk about, of course, the other aspect is how you have to work in this space from your heart and what you have to contribute. But please remember, in the next decade, if you're looking at jobs, this is where it's going to come from. So it's very important that you understand this field, geriatric psychology, and participate in it. Now, having said that, first of all, thank you, Dr. Meghna, and thank you to the college for inviting me to do this presentation. India, my dear friends, as you realize now, we are undergoing what is called an economic and demographic transition. What do I mean by that? So economically, since we are an emerging economy and we are getting richer and richer by the day, what is happening is health services are improving. And as health services improve, longevity increases. So we are seeing more and more people now survive into the 80s and 90s. I think I recently read, was it the WHO or something, who announced that the new old, who do we call old now? And they're saying at 60, you're still in the young age. So I'm just turned 63. So I know that when I think of 63, I always called myself a Jerry, geriatric. So I keep saying, I'm a Jerry. And suddenly I'm being told that you're young. And which tells me that you now can reach 90, 100 and live your life. However, I think, unfortunately, even though we are living longer lives, our brain or our body systems are still not evolutionary wise equipped to grow old fully. So there are cognitive changes which are going to come naturally. There's going to be, we will live older, but we will need support and help. We can live wonderful lives, good, great quality of lives, but we need people like you. We need that support. So that is the economic transition giving to this longevity that's happening. The second interesting thing is the demographic changes that are happening in our country. So currently, India is regarded as having one of the few in the world who have the youngest population. Youth is here. And that's why we say India has an opportunity, to economically grow, because there are so many young people over here. But that is changing. By 2050, in the next few decades, we are going to see a very large population of elderly people. So that demographic opportunity is going to disappear. And we are very ill-equipped right now in terms of our planning and thinking of infrastructure of what we're going to do when that demographic change happens. Can I have the next slide? So just a couple of slides very quickly. So people always ask me that what is dementia and Alzheimer's? Are they different? So that's a question that comes up. So dementia is an umbrella term. When we say someone has dementia, we are saying that they have some form of cognitive impairment. And by cognitive impairment, cognition, functions of the brain, memory, attention, executive functioning, etc. So when there is an impairment in any of the cognitive functions, we call it a dementia. But there are different types of dementia. The presenting symptoms are different. Like in Alzheimer's, it's memory as the main component which gets affected. In the others, there are other components. So, but we have to understand that when we talk about the various types of dementia, Alzheimer's is the most common. There are different pathologies also in the brain which cause the different types of dementia. One day I hope you will invite me to take you through the science of Alzheimer's, and it's fascinating and you'll understand that. Next one, please. Now let's just very quickly look at some facts that we have. I think this will be repeated by a lot of the speakers through the day. You have to see that one of the largest, it's getting to be high up on the list for a cause of disability in the world. So again, as psychologists think it's an area where a lot of support is required. Alzheimer's disease is becoming one of the leading causes. Next. Next, please. And look at the numbers, and they're growing. Just look at 10 million new diagnoses expected every year. So as I said, as the decades go by, you're going to see huge numbers of people who will require the kind of psychology support we're going to talk about next. And this is the biggest tragedy so far, I think. Despite huge amount of work that has happened, despite millions and billions of dollars being put into research, currently we can say that there's no real treatment. There is medication, and I think Dr. D'Souza will tell you a lot about that, that yes, we do have medication which will, kind of slow down the process, but nothing to reverse and nothing to cure. Next. So look at this kind of research that has poured in, because there have been various hypotheses. What is causing Alzheimer's? We're still not clear about it. We spent billions of dollars looking at the whole amyloid theory, that there is amyloid plaques in the brain and we should see how we can get rid of those to improve the condition. But now, in fact, recently there's been a lot of criticism and talk about that this hypothesis is not working. We have to rethink, wear a new hat, and start thinking again about pharmacotherapy and what is the real pathology. So there are a number of causative factors, and that is the challenge. It's multi-etiological, as we say it. Next. Now, when do the patients really come to us? So the interesting thing about Alzheimer's, these degenerative conditions, is that actually the pathology in the brain has started long back, sometimes even a decade or 15 years ago, before the symptoms actually are seen. So, I'm looking normal to you, but I don't know. The pathology may have started, it may emerge 10 years later. I may be having Alzheimer's. So that is a real challenge, because now the thinking is, can we find biomarkers? Can we find imaging techniques to pick it up in this preclinical stage, before the Alzheimer's is seen? If we could pick it up there and intervene there, maybe we have hope of the person getting better. But right now we're at a loss. So they come to us. In the past, I've been here in the field for 25 years. In the past, I never saw patients come to us, even in the mild cognitive impairment stage, the next stage. They came to us when it was clinically evident. That means you could see the symptoms, everybody understood the person is clearly forgetful. And they came to us for rehab. Now they're coming to us because of growing awareness. We're talking about it. But now, there is even that benign forgetfulness. You get older, you forget, and you say, because of the awareness, oh my God, am I getting Alzheimer's? Let me go and get checked out. So the diagnostics, they're coming in for diagnostics, and that's where psychologists come in again, neuropsychological cognitive assessments in the preclinical stage. And we do with our standardized tests, and what we're trying to say is your forgetting different from normal aging forgetting? So all of us forget when we grow old. But when they're coming to us with our great tests, we're able to discriminate, no, this is a little more, you're beyond the norm. And that's the first kind of a marker. And then we inform our neurologists and psychiatrists that we think the person is in a mild cognitive impairment. Of course, the treatment about that is another whole story, whether what you should treat or not treat or what we should do. The rest of the stages, they come to us more for the rehab. And rehab in an Alzheimer's person, in the early stages, yes, there is cognitive therapy and cognitive rehabilitation, but pretty much later, it's all about the caregiver. The whole work in Alzheimer's disease as psychologists, you have to focus on helping that caregiver. Next. So this is again just the stages that the person goes through, no symptoms, and there's a benign forgetfulness. They just forget where you kept your glasses. That happens to me a lot of times. I forget where I keep my spectacles, or just very simple things. Some of us flag it, some of us don't. And then, of course, it becomes evident to others. Everyone's saying, oh, you're very forgetful. People are beginning to notice. And then, of course, the other things happen. Language deteriorates, activities of daily living go down. You're not able to function. Functionally, you go down. And then, of course, finally, you're quite bedridden. Next. So what I did was, just quickly now for the next 5-7 minutes, is I tried to make this an acronym, Alzheimer's, just to send some messages out to you about what you have to think as psychologists when you have to support Alzheimer's. So if you look at A from Alzheimer's, I looked at it as acceptance. It's very hard for people in the early stages to accept this diagnosis, and I think all of you will appreciate and empathize with that. Today, if I'm at this stage now, in my early stage, I'm told that you have the diagnosis of Alzheimer's, I know that in the next 10, 15 years, I'm not going to know you all, I'm not going to recognize you, I'm not going to know you. Imagine how scary that is. And even for the family, for them to know that their loved one now is going to reach that stage. So this work as psychologists about walking people through this acceptance, and in a dynamic acceptance, that how can we still keep our quality of life, maintain ourselves, is very, very important. Next. Love, I think in that video you all showed, there was also the mention of love, right? So for me, this is very important because, you know, anytime you see the person with Alzheimer's in the advanced stage and you think they're not comprehending anything, they're not there. But you know that even if you stroke their hands, that tactile, that expression of love, your expression when you're talking to them, your voice, your soothing, they're non-verbal, non-communicating. But love is such a powerful tool, it can just shine through even if your cognition is failing through. Something deep within picks up that love. So that I talk to families, you know, it's not about you trying to stimulate. Families get anxious. They want to stimulate the person, cognitive, cognitive, cognitive. Sometimes it's non-verbal, it's just giving that hug, it's just touching, it's just being with that person. So that expression of love, I think, is extremely important. Next. I didn't know what to put for Z. And then I thought of this zealous care, and we have a person here in our audience, Vidyaji, and she will be talking to you. I think she is the epitome of zealous care. So when we talk about zealous care or zealous care, it's this passionate, this sense of passion, passionate support for a cause or for that person. So caregivers burn out. And somewhere they always say, why me? There comes a phase of why me? Why do I have to go through? And the suffering is at two levels. The suffering is one, to see your loved one just decline in front of you. And the suffering is also you're beginning to feel irritated and angry with your loved one. And the guilt you go through that I'm not liking this person who is my loved one, because it's very, very tough and very difficult. And that emotion that goes through reduces the sense of passion or compassion for the person. So this need to inspire or instill, still hold the caregiver to make them still feel passionate. And for young people like you to have a passionate support of this cause, these are the people who are going to be in large numbers in your society, in your ecosystem, you have to live with them. And unless you're passionate about helping them, this is not going to work. Next. Creating hope. I'm always, you know, in my work, it's always about creating hope in a hopeless situation. I'm always seeing people who actually there is nothing for them to hope. It's horrible. It's hopeless situations. And yet as psychologists, this is our expertise, is how do you instill that despite everything that happens in your life, everything seems dark, you feel you're in a tunnel, how do you still make them see the light? That still this moment where you're alive and you're here, this is an important moment. Live now in this moment and do the best you can. So instilling that hope. Next. Empathy, of course, I don't have to teach the psychologists about empathy. That's the core of our training. But you have to understand the fears and anxiety of a person with Alzheimer's. They are extremely frightened. They come through behaviorally as irritable. They come through very challenging. But they are frightened, they are anxious, they are worried, and that behavior deteriorates because of that. How do you address that? And you know, you have to, as somebody said in the video also, you have to remember there's a person behind it with a story. I get people who are CEOs, okay? They've been used to being at the top of their companies, handling, I had yesterday a person who handled a group of 7,000 employees. And now he's deteriorating. His sense of himself is still CEO, head of the family. But now the family is telling them, do this, don't do this, stand here, eat this, do that. He is so irritable and so upset and deteriorating behaviorally. You cannot forget the story of the person who has the dementia and respect that despite them not being there cognitively. They pick up that. So that's very, very important. Next. Independence is an extremely important thing. We all want autonomy. We hate being dependent on others. The person with Alzheimer's struggles and fights this. They don't like being dependent on you. They will fight it, and you still know that they can't do it on their own. And yet they are dependent. It's a lot of mixed signals. You know, when they come into the clinic, you'll see the person, supposing it's a man with Alzheimer's. Anything I'm asking them, they'll keep looking at the wife, or the vice versa, or the wife will look at the husband. That to me is the first clinical sign that there is forgetfulness, because it's like a reassurance from the spouse that am I saying everything all right? There is this level of independence that the spouses complain that they can't go out anywhere because they get very anxious, the person, the patient. Where is she gone? Even for 5 minutes, I want her. So there is a dependency, and yet, ironically, they will assert their independence in silly things and not follow what you're telling them. So it's a huge struggle, and you have to work your way through that. Next. Let's look at the M, which is on the medical management. I think even though we're talking about counseling skills and important things, it's important for you to understand the pharmacotherapy because it does have a very important role. And when we're talking about pharmacotherapy, as I said, it's an evolving field. We are still looking for the right kind of medications. There's been a failure in targeting the amyloid plaques, but now also the new interest in it being an inflammatory disease. Is it a form of neuroinflammation, and whether we should have new targets for that? So there's a lot of research happening, and you need to keep abreast with that to understand that and even counsel your families about the importance of medication or the lack of it. Next. Exercise to me is very important. So I think physical exercise also. I'll still just tell you that I had a lady in my own building, and the family came to me when in the very early stages when Alzheimer's was detected, and they said, what should we do with her? I said, there's only one thing I'm telling you, just keep her walking. Whatever you do, just instill in her head that morning, evening she has to walk, so she doesn't get bedridden in the end. I think she survived 15 years after I said that to them. And care for the caregivers. Respite is important for them. And support this great seminar you're having. Go out there. Today, go out and talk to 10 people about Alzheimer's and form that chain and tell each one of them, go and talk to 10 other people. You immediately create awareness. Last, please. So this is a book, wonderful book. There's also a film being made. You can watch it. It's a very old film, old book that I read many years ago. The story, of course, it's a story about a Harvard professor who realizes that she has Alzheimer's disease, and written in the first person of what she goes through as she loses her memories. And I really like this quote from there. But just because I'll forget it some tomorrow doesn't mean that I didn't live every second of it today. I will forget today, but that doesn't mean that today didn't matter. So let's make today matter for our elders, and I'm sure you all will do a great job. And thank you for your attention. Thank you.
I think many of the speakers will cover a lot of things. My job in the next 15-20 minutes is to give you an overview of symptoms that you see in a patient with dementia. The first message that I want to give all of you is you can see almost any symptom in a patient with dementia. So, and we normally associate dementia with memory loss. But remember that many patients do not present with memory loss first. They may sometimes present with subtle behavioral changes, subtle personality changes, which may not be detected. People may think, oh, he's going old, so he's become cranky, or he's going old, so his personality is changing, or he's going old, so he's depressed. But they might be the first symptoms of dementia. Now, there are, whenever you study for an exam, in your textbook you generally mark things as important and you write IMP and you underline it. So how do I tell my students to remember the symptoms of dementia is IMP. I is intellect or cognition. You will see some changes there. M is memory and P is personality. So these are three things which deteriorate. Now, I'm going to share with you patients that I have seen and what I've learned from them, and then the symptoms will come out. A 78-year-old man was brought to me, very well-read, educated person, suddenly showing deterioration. He had no memory loss. He remembered everything. Slight memory loss in the form of not remembering numbers and addresses and all over there, which was okay. But he recognized people. But he became aggressive. He would pick up fights with people in his building for no reason. So he would fight with the watchman, he would fight with the milkman, he would fight with the servant that the chapatis are not proper. He would get abusive, and the relatives thought, maybe he's in depression because of old age or whatever. So when they brought him to me, we said, probably he has dementia. And they said, no, he has no memory loss, so how can he have dementia? And I told them, he's undergoing a personality change. Now always remember, old people, when they have dementia, they undergo two types of personality changes. One, whatever was their personality earlier becomes accentuated and more. So if I was aggressive, I get more aggressive. If I was docile, I get more docile. Or the personality becomes totally the opposite. So if I was a very quiet person, I can get very aggressive. If I was a very talkative person, I can get very quiet. If I was very quiet, I can get talkative. So you can have those changes. So here the changes were opposite. This man began to get aggressive, abusive, and people were like, this is not he. We don't know him, we've never seen him. He even hit the watchman. I mean, this is something which, daddy never did in 40 years, and how come? So when they brought him to me, we said he has dementia, and again, medication-wise, we have no cure for dementia. We have some medicines that work, but in the early stages, in the later stages, we have no cure. But what we can do is treat the behavioral issues. So if someone is aggressive, we can treat that. If someone is not sleeping, we can treat that. And another problem is, so one is these personality changes. The second very common symptom in dementia is change in the sleep-wake cycle. So you get a lot of patients who feel lazy in the day. So they'll sleep from 1 in the afternoon to 6, 7 in the evening. Then 7 o'clock they'll get up, and then they're very alert after that. And by 11 o'clock they're at the peak of alertness when all the family members want to go to sleep. So then they want to see the TV, they'll roam around the house, they'll say I'm going down. And it gets very irritating for the family members who are working. At 3 in the night they'll put music, or they'll go to the kitchen, make some noise, spill the milk, open the fridge, and in smaller houses, every room you can hear the noise, so it becomes very difficult. So this is what we call, and many of these patients worsen in the evening. They get more aggressive in the evening. Clinically it is called sundowning. Sundowning in partying circuits has a different meaning, but sundowning in dementia primarily means they worsen in the evening. So you see these behavioral symptoms. The relatives often come and say that, sir, put him to sleep. Do something ki wo raat ko so jaye, because, but then I tell them that you have to keep him awake in the day. If you allow him to sleep the whole afternoon because you all are working, he's not going to be, I can't just over-medicate him and put him to sleep in the night. So keep him alert and active the whole day, so that by 8 o'clock he only goes to sleep. That is something which is important. Another symptom that you see, always remember, the memory loss in dementia is very patchy. So there's no fixed pattern. You may see some people with very rapid deterioration. That is, the memory loss starts today. By March, April, they are in a very bad state. You have some people, the memory loss starts today. Next 5 years, there's nothing that happens. Then there's some deterioration. And every 3-4 years, there's deterioration. So the course varies. So you have two types of dementia. You have a progressive fast dementia where the deterioration is very fast, and then you have a slow dementia where the deterioration is slow and over time. Another symptom is repetitive asking of questions. I remember I went for a home visit to see a Parsi gentleman who was 80 plus, and and they said he's having memory loss and this and that. And they said one symptom he has is he keeps feeling hungry. So, while I was talking to him, every time in the middle he would say, Kai aapne, he would go on saying because he wanted to eat. And imagine him doing that the whole day. It would get very irritating for the relatives if he's going to ask the same thing. And things stick in their mind. So they very often, keep asking the same thing. Or they'll say, give me breakfast, give me breakfast, give me, Arey Baba, we've given you breakfast, you had no, give me breakfast. It gets irritating after some time. So then they say, no, now it is lunchtime. Okay, give me lunch, he'll go on. So it gets irritating for the relative. So repetitive talking is one thing. They also mistake people. So I remember I have a patient with dementia who comes to my clinic, and he doesn't accept that I'm the doctor. He calls me Chunilal because he feels that I'm a friend of his. And the son said, he has a friend who's bald, stout like you. So he thinks you are that person. So I told him my doctor who ye steto hai. So he'll say, Arey Chunilal steto kahan se le liya? He'll ask me like that. But he will not accept that I'm doctor. So I said, theek hai, you call me Chunilal, I'll be happy. So and every week he'll say Chunilal ko milne jana hai, he'll come. But it's okay. He comes, he'll sit, he'll go. He's not behaviorally a problem, so people are not so worried about him. There is another patient of dementia just opposite building, and he's an uncle who I've seen when I was growing up, so he knows me by name. So every evening 6 o'clock he comes to my clinic and he'll sit in the waiting room and he'll tell my receptionist कि मेरा 8:30 बजे का अपॉइंटमेंट है, बट मैं ऐसे आके मतलब बैठा हूँ. The good thing about him is that he does some positive marketing for me. So he sits in the waiting room and every patient that comes in say बहुत अच्छे डॉक्टर है, you know मैं इतने साल से आ रहा हूँ, बहुत अच्छे हैं. So the patients feel ठीक है, good. So he'll say आप इन्हीं से ट्रीटमेंट लेना, and he'll say मेरा 8:30 बजे का अपॉइंटमेंट है. And they all tell him आप अंदर नहीं जा रहे हैं, ऐसे नहीं मेरा 8:30 का अपॉइंटमेंट है. Then 8:30 he knows to read the time. So 8:30 he'll see the time. He'll say नहीं डॉक्टर आज बिजी है ना, मैं कल आता हूँ, you know he'll tell. And मैं अभी खाना खाने के लिए चला जाता हूँ. And his watchman comes from his building and takes him. And I know his son was in school with me, so I said let him come, let him sit, let his evening pass nicely. And he will meet a lot of people, and and he will tell everyone that anything. And of course patients know he probably has an old age issue. So one lady came and he said, you look like my chemistry teacher, he'll tell her. And then he'll say, so that lady said, no, no, you look like her. And he'll ask her, what is your name? So she said, my name is Renuka. No, I will call you Lata, and he will keep calling her Lata and talk to her. So his evening passes in my clinic, and in post-COVID, when I reopened, this trend started. He started coming, and he comes because now it rains, so they don't send him anywhere, so he comes to my clinic. Then sometimes, I remember, the alertness of individuals with dementia also. Courier man came in, and courier man was waiting, so he asked him, तुम किधर रहता है? So that fellow said, हमको कल्याण जाना है. He says, लाओ मैं साइन करके ले लेता हूँ. So he signed. He says, हाँ मैं ये डॉक्टर साहब का मैं रिलेटिव ही हूँ. So he signed. He took the courier. He said, इसको जाने दो. He said, courier डॉक्टर साहब को दे दो. So that alertness he had, but otherwise there were issues with intellect. Another instance I remember of a physics professor who lost a lot of memory. He wouldn't recognize relatives, he wouldn't recognize friends, he would not remember things. And he was my physics teacher in 12th standard, so they called me to see him, and I was very upset to see him in that state because I had seen him at the peak of his teaching career when he used to teach us. So it so happened that they asked me what activity can we do with him. So I said, would showing him something in physics interest him, because that is something which he knew. So they said, no, he has lost all memory. So I told his son, who was in the 9th standard, I said, why don't you show him some of your physics books and see if, So his son drew a diagram of some lenses in his journal, and he took it and said, Dadaji, see this. So he said the arrow which is below is wrong, he told him, And he said that you labeled the diagram also wrong. So they said, अरे मतलब कैसे बोल रहा है, कुछ भी बोल रहा होगा. And when he checked, the son said, he's right, I have labeled it wrong. How does he remember that when he doesn't remember me by name? So I said, because he's taught that for so many years, it's probably so deeply ingrained in his brain. So remote memories don't go, as madam said, they remain. So they'll always remember things of the past, they'll always remember things of what happened. I have a school teacher of mine who has dementia. She remembers our entire school batch, but she doesn't remember the recent batches. She'll remember all the batches of the 90s that she taught, by name, by roll number, but recent memory is totally gone. So that's how dementia works. Sometimes you may see some sexual symptoms in dementia which can get embarrassing for the relatives. They may disrobe, they may come out naked, they might touch someone inappropriately. That also brings us to a very important question that in a dementia home, somebody asked me that we talk about maintaining boundaries with patients. So should nurses touch dementia patients, hold their hands? I said, of course. You're engaging in healthy touch. And touch is a sensory modality that these patients need, so there's no harm. And dementia patients can, occasionally crack a joke with the nurse. So you can have an old person who will tell the nurse, if I met you 40 years earlier, I would have married you. I mean, those kind of things. And the nurses have to learn how to handle it. They have to not feel upset. Sometimes it can happen that they may want to they'll hold the nurse's hand too tight. They have to gently release it. They have to learn to handle these subtle symptoms also. I also, tell people that the problem in India, one major problem is what I call PICA, P-I-C-A, parents in India and children abroad, which is what I see a lot in Bandra, Khar, Santa Cruz. So there are a lot of old people who I handle, and the children are in New Zealand, Australia, England, Europe. And when I phone them that, daddy has had a fall in the bathroom and this and that, it's sad, but the answer that I get is, doctor, you get everything done, and let me know how much I have to transfer, but we can't come down and see him, they'll very often say. They'll only come down when he dies because they didn't want to claim the flat or the property which is there. So these things often come up. Another thing is people come to you sometimes because some patients with dementia have not made a will, and then they are worried now, how is the property going to go? So they want you to certify that he's fit or unfit. And I generally say if he's not made a will, then it's sad, but we can't certify him fit to make a will now in his current state. So those are things which also come up. There's one point which I will just highlight. I have 5 minutes. That geriatric mental health in general, I feel is neglected. I feel, elderly suicide, elderly depression. People feel, abhi ye umar mein depression nahi hoga to kya hoga, at 70 plus. So they don't bring them for treatment. And these are patients who like to speak, like to be heard. So even busy clinicians have to give them a lot of time. That so I have an old lady who comes to my clinic. She's mild cognitive impairment, not dementia. But she'll write a poem and say, मैंने आज नया poem लिखा है, आपको सुनाना है. And the son will say, अरे नहीं, बहुत time नहीं है डॉक्टर के पास, आप 2 लाइन सुनाओ. And I'll very often say, नहीं, उनको पूरा सुनाने दो. And she'll tell me the poem, and then I'll say, आपने ये शब्द क्यों चुना, आप ये डालो, वो डालो. That interests her more. Her illness doesn't worry her. The antidepressant I give doesn't worry her. The prescription doesn't worry her. She'll just swallow the tablets mechanically. But the fact that someone is giving her attention is what is important. And I tell the children, I said, spend half an hour with her. You'll have 5 over you. So 2.5 hours a day, people spending time with her will, give her a lot of impetus to do. So she told me that, अगर मैं मेरे कविता का book लिखूंगी, तो will you write the foreword? I said, yeah, I will write, don't worry. And they said, sir, कहाँ book छपेगा? I said, 5 book छाप दो, let her feel good कि हाँ उसका book छप गया. We don't have to sell the book. I said, so these are small dreams that they have, which we can fulfill. So we got the local printer, 1000 रुपए में 5 book छप गए. We told her, देखो आपका book छपा है. So she was so happy. Well, these are small things that make a huge difference to them. I always remember one patient, which is my last example before I close. Patients with dementia have a lot of zeal to live. It's not that they want to die. So I remember a man I saw who was 77, I think. He was an IIT professor who then developed dementia. And somehow I've seen many intellectual people tend to develop dementia a lot. I don't know why, but probably they use up a lot of cognition maybe in their early years. So they tend to lose it later. So he asked me, he said, do you think I'm going to develop dementia? So I said, sir, you're in the early stages right now. So he said, can I, do you think it's right if I just end my life now? I don't want to be in that hopeless state. And I said, laws don't permit it. I can't permit it. I don't believe in euthanasia, and I don't allow euthanasia, and I don't permit it. So he said, no, he said, the problem is, he said, that, I know that this battle with memory, I'm not going to win. I'm going to go out losing. But, doctor, I want to go out swinging. So how do I do that? So I told him, go on a tour, enjoy life, see the world. I said, do you have enough money to go? He said, yeah, there's no problem. So he went on a world tour for nearly 40-50 days. He came back, and the best part was that his memory didn't deteriorate for the next 10 years. Why, I don't know. I don't know whether that intervention helped or his dementia was slow, but it didn't deteriorate. And then after 10 years, there was some deterioration. Now also he's pretty stable. So sometimes, you feel it's going to deteriorate, but it won't. And there are some patients who get bedridden very fast. So that's there. What's very important is to understand is that the patient with dementia is not giving you a hard time. The patient is having a hard time. I always say he's not, intending to give you a hard time. And this was someone who was very active, very good. So it's all, I think, very, very important that I tell people that we have to remember that they are not a file number, they're not a bed number, they're not a patient number. These are individuals who were there. And I think the best part that you can do for someone with dementia is give them time. That's important. Thank you.
Questions for Sir and Vish ma'am. If anyone has any questions, you can raise your hand and ask if anyone has any questions. Is dementia hereditary? Is it passed on in the family? That is the case. Then how do we prepare ourselves for something?
Well, it is genetic, but there's no way we can find out. I mean, you are at a risk. So if you exercise, maintain your cognition, are active, don't smoke, don't drink, all that, I think you can prevent yourself in some ways.
Thank you. Any other question? Yes. Ma'am, as you have said, as we take care of the loved one, we often feel burnt out. So how do we take care of ourselves?
So that's why we talk about this respite for caregivers. And I don't think in our country yet we have got that well organized. We need to create facilities where the caregiver can go away for a little while. The caregivers need counseling. See, many of them don't come for counseling. I've been doing a lot of work with Parkinson's disease also now, that's elderly people. And we did this whole lot of focus groups, as we call them, with the caregivers. It was very interesting for me that in the Indian context, and I talk to our British counterparts and I hear the story from them. In India, the caregivers do not look at it as a burden. The word burden. So when you ask them that now, are you feeling a burden? You have a loved one you have to look after so long. They all were saying more, they were saying this is not the burden, but, and all their questions were about how do I help that person more? What do I do for the person? And there's a lot of research now coming up to say that this thing, that they feel guilty to say that it is a burden to look after a loved one. That's cultural. Farz hai, exactly. It's my duty. How can you call it a burden? So that to me is the first psychological thing, that if you're going to go into this, that it's my duty, it's tough. You are going to crash. First to acknowledge that it is okay to say I'm not okay. First message, start with the caregivers. Come to us, talk to us. It's okay for you to say, right now I can't live with this person. I'm finding it very difficult. I don't like this person anymore. It's okay. Then it's okay to go away. Most of these caregivers I find, even if they go for a movie and they've left the person with a caretaker, I don't want to go for a movie, I don't want to go for a party, I don't want to go to the parlor, the wife will tell me. They have become widowed without being widowed. They are in bereavement even before they are bereaved. So this pulling out and saying it's okay for you to enjoy your life, get out there, then you won't burn out. So there are multiple things like this, but culturally we have to really shake them up and get them out and get them to live a life. I don't know whether you want to add something.
No.
You have a question? Any other question? What would be the earliest sign, like I want to say, there's not a lot of awareness in my family, and if I'm seeing something, then what would make me go like, okay, now I think we should bridge. So what would be the earliest?
I think any subtle memory loss, any subtle behavioral changes you see, just get a checkup done. Even if it's normal, at least you know.
So, the way I get the references from the neurologists, quite a few of them, is the person, very often the person will come to the clinic and say there's nothing wrong with me, but my family is insisting that there's something wrong with me. So there's first that defensiveness. And the family says, as doctor was telling you, he or she is not the same person they were. Something has changed in them. That is like they're not able to sometimes pinpoint, but they say they are not who that person was. Then there are the subtle memory losses. The persons who come to me on their own directly eventually end up in a category, diagnostic category we call worried well. So you have mild cognitive impairment on our testing. Many of them come out normal. But then they tell you that they have a family history. They say my father had Alzheimer's, my grandfather had Alzheimer's, my sibling had Alzheimer's. Now with the awareness, I feel I'm forgetting, I need to get checked. So that's one category who end up, they don't have it yet at least, they are worried well. And many of them who the families bring, end up we find on our testing and the scores, yes, that they have shifted. That is there. But they are in denial.
Ma'am, I had one question, now that I'm listening to this. I remember when I was taking care of my father when I got him from Calcutta and he was with me, of course, for some other illness. There used to be times when I used to go home and I used to see the geyser switch on. She's gone for a month, let the geyser on the whole day. But which doctor do we go first to? Do we go to a psychologist? Do we go to a neurologist? I don't know, because I think many of them have grandparents, or do we go to a psychiatrist?
So I still remember one conference where I was there in Sri Chitra down there, and the talk was first by the neurologist and the psychiatrist, and then I as a neuropsychologist. And each one of us was claiming that ownership of the patient with Alzheimer's. So I don't think it's that.
When you put it that way, then go anywhere. Get help. That's important.
Yes, get help.
Yeah.
So it may start with me. Sometimes somebody knows me, they come to me, but I will refer to the neurologist and psychiatrist. But I don't know what sir has
It's
to
a
say.
family physician.
It's a family physician goes first.
I did mention this to the family physician, but they say मान जी का उम्र हो गया है, ये तो उम्र में
That's a
होना
very good
है।
point.
And
So,
doctors say it's medicine side effects, but if these are the symptoms.
so now there's another thing. There's also, I think, a lot of research came out on this for the Indian population, where it is this whole culture of accepting cognitive changes as a part of aging. Like after a certain age, you don't have to be independent. हमारे culture में क्या है कि once you get a daughter-in-law, so now she's supposed to look after the house. Mother-in-law will sit on the bed and say, now my days, now I have to chill. So sometimes taking the history, I ask that mother-in-law sitting on the bed. Now the question here is that mother-in-law just sitting and not interfering? Or is that mother-in-law from the bed saying, what have you cooked? What is the menu? What is happening in the kitchen? If she's asking those questions, Alzheimer's has not started. If she's just sitting over there and just passively, then you have to start thinking that why is she not participating? But our culture does not allow this admission, and as you just rightly said, the doctor will say, everybody will say, it's a part of aging. अभी भूल गए तो क्या बड़ी बात है? What is wrong with that? So we miss out, I think, in the early stages, a lot of the diagnosis. Till behaviorally they start deteriorating, and the memory loss is very evident. So early stages get missed.
See, it also depends on how much the symptom is distressing to the family.
Yeah, exactly.
So it's like
Yeah.
वो चिल्ला रहा है, then they'll bring him.
Yeah.
मार रहा है, तो then they'll bring him. थोड़ा याद शक्ति चला गया तो they are not so worried.
Yeah, behaviorally they deteriorate, they are with you.
Yeah.
Yes, one more question. Yes.
We visit them. I mean, there are doctors who visit them. I visit a few old age homes. I'm sure others visit. So we try and provide whatever help we can.
But it is a
It's
tragic
difficult.
situation.
It is difficult, yes.
And that's where India scores still compared to the Western world, that we have families who still care. It's both ways. I think it's a two-edged thing,
Yeah.
because on one hand we don't have that many facilities like this which are required in the country, because we still believe that culturally, we have to look after our elders. But at the same time, yes, There's a huge burden on the caregivers at home, because we don't have those facilities.
See, they will keep three caregivers, three paid caregivers, and manage the person at home. But putting him in an old age home is a big stigma
Big
in
stigma.
India.
Big stigma.
कि
So-
मतलब माँ बाप से हाथ धो लिया, it is that kind of
You are
thing.
neglecting. Very interesting. I had done some community work, and these are normal elders, and it was from the lower socioeconomic class. So in a group setting, we had asked them that you're living in this one room, with 5-6 people, and the children are working. You're kind of neglected. Nobody is looking at you. So tomorrow, if we put you in a wonderful facility, बहुत अच्छा है वहाँ पर, all the सुविधा है, सब है, you'll be very well looked after. Will you go there? It was very interesting for me. I think almost everybody said no. And why? Because being surrounded, even if I can watch my grandchildren from a distance, they're not talking to me, but they're playing around me. I can see my daughter-in-law, I can see my son's face. That is far more important to me, even if I have to sit in one corner in that room, even if nobody is looking at me, but we want that. So there is a sense of wanting to be with the family.
I think, yes, last question please. Yes.
We know that our grandparents have symptoms, but they refuse it. So how do we get them to get checked?
They refuse to, they don't think they have symptoms.
Yes.
So what do you do?
I think you can take them for a physical checkup
Exactly.
and inform the doctor that we want you to assess.
They
For-
refuses to go there.
No, tell them you're going for your physical checkup.
You have to tell them.
BP,
Yeah.
sugar, ये सब check करने जा रहे हैं.
हाँ.
And then उस बहाने से, see, I have a lot of people who bring the patient to me saying I'm a physician. So I will check, I'll put my stethos, so they feel हाँ मतलब ये psychiatrist नहीं है. And then indirectly when I will ask them about memory, they'll answer. But if they knew they were going to a psychiatrist, it would have been a big problem.
Correct.
Yeah.
Stigma is too much. That's where you come in. The awareness programs is that there should not be that stigma.
I think we have to give a huge round of applause to both Dr. Urvashi Shah and Dr. Avinash D'Souza. There are lots of points. This is what I was telling you, two most eminent people from our industry, psychiatrists and neurologists. And this is what you understand because we have grandparents, right? And we need to wake up, start focusing on the geriatric population, take care, love. It's okay to come to college, but it's also okay to take a chocolate for them back home and say, Nani, Nana, this chocolate is for you, I had a good day. Yes, once again, thank you so much for taking time out. Very busy people, but taking out that time and coming. And of course, thank you very much, sir. Sure, sir.
Since ma'am mentioned about the chocolate, I'll share one experience. I used to go to an old age home. I still go there. Of course, the person I'm talking about passed away a few years ago. So he would always smile and see me, and he had dementia over a period of time. So one day when he gave me a big dairy milk when I went there. So I asked him, I said, why are you giving me this? So he said, no, you come here as a doctor, you look after us. I don't know your name, but I thought I should give you a chocolate. And then his cognition, he said, don't eat it, it will finish. Then I don't have another chocolate to give you. He told me so.
Thank you so much, sir, for taking time out of your busy schedule to speak to
The
us.
dictionary meaning of reinforce. Reinforce stands for many things like encourage, strengthen, then help, instruct, learn. So these are synonyms out there. So the word itself says ki one of the students asked like ki, if you tell to person that you are having a problem and we forcibly say now you do this or do that or just come for the investigations and all that, they won't listen. So what we need there is encouragement and to deal with the empathy. Now, in first talk you might have seen that very beautifully Dr. Urvashi Shah has, you can say she has described the full form of Alzheimer's. A is acceptance, which is very important. Like I would like to say, right from birth till the death, every day we are getting older, isn't it? On first birthday, what we celebrate? On first birthday, we celebrate and what we write? I am 1 year old. So right from birth, every day you are getting older and older till you die. Infant which is newborn, 1 day old, child, newborn, 7 days old, or till 1 month is as a newborn, infant 1 year. So then we call it like, say, 7 days old child. So this is a thing which going to happen to everyone. So what is important, like, two things are there, like those who are already suffering from the disease, maybe dementia, Alzheimer, or the prevention of it. Today's motto is also what you have written is support, encourage, prevent, then traverse. It consists of everything, like the persons those are suffering from, how to give the support or encouragement to them. Coming to the topic now. Now the thing is that, like, to help the person who's suffering from dementia or Alzheimer is to understand his former lifestyle, because like Dr. Avinash has said, he has elicited or he has given the example of physics professor. So the old memories are there in the brain, like, so you have to just give some sparks to them. So first thing is the lifestyle. Second thing is work history. Third thing is the social and the recreational, how he is socially connected, how the recreational things he does or she does. Then the lifetime events, like important events. The best event is a marriage, which no one can forget. Like if you just seeing the videos, the person thinks jokes is there. Like when if your person is seeing his marriage video tapings and all that, if possible, I could have rewind it. So then the things will go back and then it will. So that is important thing is like to understand the history, the work history. Like he said, like the physics professor, what he has given the example. Understanding is a lifestyle. As rightly one student has said, like not for everyone they can keep the caregivers, like the paid ones and all. But the word caregiver, it may stands for the even your relatives also. The child would be the caregiver of the parents and all that. But the professional caregivers, whether they will be able to hire or not, again is question. So importance is the acceptance that the person is having the problem. But don't tell that you are having a problem. Telling this that you are having problem is a big problem. The best way is to encourage them. Any one of us may get in later age, older age, we may get Alzheimer, dementia. No one, as said, there is no, like, the brain is very complex structure and still the medical science have not completely explored it. That's why we correlate with the spirituality. The olden age, you might have seen the Rishi Munis and all these things, saints used to do the meditations and they used to connect and all these things. So the medical science can't prove it like you have gained the insight vision and all these things. So that is very important, like knowing the history of the person, lifestyle, what he was doing, or so that will help. And the social. Now the what activities we can do with the persons with Alzheimer or dementia. So first is they reestablish the old rule. That is the very important. As I said, what they were doing earlier, what they were best in, like, so anything like which they like, the buttering the bread or gardening or the things what they liked earlier, that will help them in preventing the further deterioration or improving the memory. Both the things are there, like, so that is the thing. Second, we can see the activities which will give the pleasure to them, like anything. So it could be a dancing, it could be playing the music or playing the musical instruments, anything and all that. Then we can take them for the outing also, because when they are at home mostly time, they are not, I mean, tense or they try to remain aloof and all this. But if it just take out in fresh airs and all these things, they can mingle with the peoples and all. Also, they should like to have interaction with the other peoples, the socially inclined and all that. But to avoid in a crowded areas, we should not take them in the crowded areas or which is very noisy and all these things. But it will be better like we take them out. But the precaution also we have to take when they are sending them out also, or when we are there and all. We can give them the bracelets where it is written, or the pendants and all that. If they are lost, at least one can. You might have seen that movie, Uri the Surgical Strike, where the GPS chips were used to, but that is not possible for everyone. But so the better thing is only the bracelets or the pendants or what, or any cheats they can carry. Like how the person with the diabetes and all this medical, they have the cards and all, keep and it becomes hypoglycemic or this thing, person fell down, and then the person can have things that other person can help them out. Or other activities also, like is the exercise would be the best things. It could be the brain exercise, which is very important. The physical exercises also. Now the physical exercises depends upon person to person. Like the person who was going to the gym, he can do the weight bearing exercises, lifting the weights and all that. But if not, the simple exercises, as madam said, the walking is the best exercise. Like they can do walking, cycling also. But now again the balancing. So it's not possible. They can have the 3-wheel cycles, or the person can the big cycles where the persons only have to do the paddlings. So like that can help them out. Then brain exercise, as I said, there are so many things are there. They can play the Sudoku, chess, or puzzle games and all this thing, which are very important. And both the things either deteriorating, slowing down the progress of the disease, also increasing the memory or the improving the memories and all that. Next part is a diet. Diet is very important, as in Alzheimer or the dementia or any kinds of. So what type of diet they should have? Diet is very important. The leafy vegetables or the leafy greens is very important, because they contains a lot of vitamins, minerals, and that is required for the brain. Means the whole body, but brain is also part of the human body. It's not something different, though it's the commanding officer, but that also requires, it's a cell only, neurons is made of those neurons, and they cells requires the minerals and all these things. Second is the fruits and vegetables. So what type of fruits you can have? Like the banana, you might have seen the shape of banana. It's smiling. If you see nowadays all of the hybrid or the synthetic things are coming, but if you see that it's like a she shape smile. Then you can have the apples. So that is important. Also you can have like berries, all type of berries, like the blueberries or the cherries and all this. They contain the flavonoids, which helps in improving the which nourishes the neurons and all that, and they prevents and further deteriorations of the neurons and all that. Then seeds you can have. There are the importance of seeds. Sunflower oil seeds are there, or flax or the pumpkin seeds, they contains flavonoids that also helps in preventing the further deteriorations and improving the memories and all that. Then protein is very important. What we normally do, like at the older age, like normally their diet is very fixed. They either have chapati bhaji or they have the rice and dal. But it's not the combination of everything or the balanced diet and all that. So apart from the physical deteriorations, they have the mental deteriorations also. So when you are arranging the food should be the balanced diet. It should contain all these things. Also the fruits will help it contains the fibers, green leafy vegetables contains the fibers which prevents the constipations and all that. So that is there. So this is about the food. Food is also very important. Exercise is very important. And as I said, like being a caregiver, we shouldn't force the things or we shouldn't point out their shortcomings. Like nowadays, as we say, na ye to buddha ho gaya, buddha satiya gaya. All these things actually does the further deteriorations rather than we should hold their hands, because all persons are going to get older. No one is here that they will remain young throughout the life, or no one is going to die. So this is a life cycle. So everyone will be in that stage. So person who is giving care, they should deal with such patient with the love, with the empathy, and they should have the respect to those older people or the person with a dementia and Alzheimer. And as I said, like most of the things is covered in the previous lectures, so I don't have much thing to explain and all. If you want to ask anything, I can give answers to it. As I said, like that depends upon the society to society. If you see in the middle class or the lower middle class, it's very rare. Why? Have you thought of? Or it's more in urban and less in rural areas. Can you think of what could be the reason? It's your social life. When you have the joint families and all, you are engaged, you get love and affections, and you are with that. As Dr. Avinash said, there is a new syndrome called as PICA. He said, na, parent in India and child in abroad. So you are lonely. Money can't buy anything, na? Money can't everything. PICA, PIC. Parent in India and child abroad. So they are lonely. They don't see money. There is a proverb you can say, money is not God, but it's not less than God. Or money can't buy everything. You cannot buy the happiness by throwing the money. You can get the care. You can get the best treatments. You can go to the 5 stars, 7 stars. You can eat the food. But what food you are eating with your family, that pleasure, that happiness, you won't get there. So this is the reason, like it is there in mostly in the upper societies or those who are lonelies and all that. So that's what I said, even the treatment, but apart from the medical treatments, what I said, the recreational thing or the social thing. So if you meet with the friends, you remember the olden days, schools and colleges days, and then you can remain young by doing all these activities.
So I had a question. Supposing there is, sorry, supposing you're not having such a strong quality life with your family, is it advisable that you stay in the room that you see the best, even though they have family, they put them in a nice, home or hospice care, and they all live with a group. We've seen that Munna movie also.
Yeah, so 6, 7.
Would you advise that?
As I said, but that depends person. First of all, can you ask the same question? I mean, if you put yourself in that position, what you would like to have? Family or old age home?
So then the reason why I'm asking is because I'm talking about a realistic situation. I stay in Bombay. My sister stays abroad. My father was alone. I lost my mother and he was a caregiver.
Yeah.
So because of medical, he cannot go abroad. He has to stay in India. And for me to work and take care of him, so we did come across this, suggestion or this thing that he didn't want to keep a full-time caretaker because the fear is there of, old home care,
Yeah,
poor
that's-
people there, mother. So we were very, very confused that, what do we do with him? So
That's what I said. No, like, I mean, that depends person to person, and situation is different here. If nothing is there, then old age home is the option. But mostly the family would be the better option rather than going to the old age homes, because there, as I said, a caregiver, his role is very limited. He will caregiver means those who are like maybe the geriatric caregivers or anything, volunteers and all. They will do their work as a job or as a salaried employee. So what about that the personal touch or the love, affections and everything? It's quite difficult to get such people, those who are really they do the work I mean with the love and affections and all that. But definitely if the situation is not there, like, so then it's there, like.
yes, Roshan. So as a caregiver, what are the few things that we should keep in mind and we should not promote?
As I said, na, Dr. Urvashi Shah has made the things simpler. What she has said: acceptance, love, jealous, caring, then the hope, then the encouragement, independence, exercise, and reminiscence therapy, and the social care or something. So same thing you have to accept and do that. As I said, like when we are dealing with this, we give the stimulus but not the over stimulus. Like suppose you were taking them out in 5-10 minutes, what they are happy with, but don't force them like you have to walk for half an hour. You play the chess only, it will improve. But he doesn't want to do that. So very critically you have to tackle those things, and but don't get yourself like angry because of that they are not listening. Anything which through the practice, so slow and steady and the repeated stimulus will help them in learning the things and all that.
My grandfather, he has dementia, but he doesn't eat much. He is losing his, yeah, he doesn't eat much. And like we try to like force him to eat, like not force him, but like make him eat, but he doesn't do that. So what should we do?
See, that's what I said. Na, like quantity is not the important. The quality is important. Like even so, the nutritious food, like you can consult to the dietitian or the, and they will make you, they will help you out like what nutritious food they should have. That's what I said. Na? Like I mean.
But he doesn't
So-
eat anything. Like he's like losing his appetite. Like he doesn't eat anything. It's like that way.
At least little bit they will have. No one can remain hungry throughout the day. So anything in a lesser quantity, but it should be more nutritious that you can plan out. Also, you should consult to the doctors. Ki, is there any underlying other problems which are causing the lesser appetite, or they are not getting that? So you do that.
Thank you.
I know it's time to go. Stop. Yeah. Yeah. So don't worry, my PPT will awaken. So thank you for inviting me here. I'm very excited to share my experiences of the not so many years, because if I say 25 years, you'll start calculating my age. But I always say that the moment you start doing things for others, that's the time you stay young. And if you commit your time for people with loss of memory, they are normally elders, I think we reverse our age to transpose the figure. So when somebody says, how old are you? Because you sound very young on the phone and you're so bubbly. So I say, okay, I'm 17 years old, almost 17 years old. So you have to transpose the number, and that's what you are. So I'm looking forward to sharing this with you. This she's already said about. So, normally what happens is that, we go to a temple or a church or a mosque, or even at home, we pray when we want something. And I think it's time we said thank you for what has been given. I don't know the reason why I've got this. It's been challenging, but I know you've got a better plan, whoever we believe in. So I acknowledge to the divine within my heart, because I believe we are no different from the super soul. And what we are today is because of our elders, more importantly our teachers, because the first teacher is the mother at home. And when we go to school, it's the school teachers and the college professors. And in our day-to-day life, I think each one is a teacher. So when Guru Purnima comes and they all, the phone gets clogged with Namaste and, Guru Purnima, seeking blessings. And I tell them, no, I said we reciprocate. Because each of us has a guru within. Each of us is learning. And I think, we can learn even from plants, we can learn from babies, we can learn from animals. So if you are open, you're transparent to share, you're willing to give, you're going to learn more and get back more. So I thank the teachers, I thank, most importantly, I have, the Universe of Memory, which is actually a daycare, dementia daycare, where I do integrative therapies. And I'm very pleased to have our coordinator, Nandini, and I have 7 girls who are very, very committed. I keep telling people that if I'm not a natural mother, then I've got 7 children with no pain and all gain. So if I'm successful today, I say that I'm just a front. I emote, I share my being, and I get back more from them. So if we have succeeded in our venture of dementia daycare, it's because they have done 99%, and I'm the one who is in front, like saying, I've been successful, So I think they are making me of what I am today. And my family with dementia, I call them not persons with dementia, I don't call them suffering with dementia, I call them my family with dementia who's living with dementia. We live with, headache, we live with other problems, but we live. So why do we suffer with this? Nobody chooses the disease. It happens. There's no etiology, anybody can get it. So we have to think that it is a probability that one could have it. So why not give when we can? And the rest will take care of itself. So I thank my family with dementia, their family, so the girls, anybody who comes to the center in my life, I'm thankful, because the people who have been living with comorbidities and challenges of life, they are the ones who have made me think out of the box. For example, we had, somebody who was very fidgety and very, very lovely. I love my family, because they give me so much that I'm happy, I'm content. We have been working sometimes till 7:30, 8, 9, 10 in the night, because our family says, yahi mera ghar hai, main nahi jaane wala hu. They don't want to go, but then we sort of say that ghar mein jaane ka hai, dur hai, then they go. So I was wondering how to get this fidgety lady out of that habit, because then it gets to be a disorder, And so I got hold of a bubble sheet, and we started playing music, and every time the dhol came on, she do tuck over time. So what happened was, what became a, I wouldn't say bad habit, it was a compulsive disorder, it suddenly became into a rhythmic music, and then she stopped doing that. So it's some, or like Bombay doesn't have, Mumbai doesn't have so many gardens, and we had a small little garden next to our center. So we take them all for a walk, and they would spend time. And then the rains came, and we couldn't take them anywhere. So what did we do? We got some pots. We gave them seeds, and they saw their plant grow. So it was like, oh, the leaf has come. Oh, a flower has come over a period of time. So we are sort of indirectly building up their cognition and their emotion to express. Normally what happens is the person with dementia, they find no words, especially frontotemporal dementia, where they can't find words, they don't know the language. An English teacher we had couldn't make a sentence. Or they would get so jumbled up that they couldn't decide. Lack of judgment. So all these things are working against them. So what we do is we prop them up, and then they can express. And maybe it's a non-verbal expression where somebody will just come and clasp the hand tight or just tap on the head. And by the way, I've called baby at the center. It feels good, it feels good. So, something where you express, you exchange. So I thank all these people. I thank the researchers who I meet at conferences. Each one is telling me a story. Each one is teaching me something. So, into new research, medical research. It's so exciting, but it's depressing because, the lobby, the pharma lobby is so powerful, they'll never have a medicine come out. Because there's a permanent note chapane ka dhanda hai wo, So even if you go to a physician, like earlier the talks were, a physician, if he doesn't want to lose the patient, he'll say, Sati buddhi nati zali jau naka, 60 years old hai, But no, it's a loss of neurons, and it's a loss that is irreplaceable, and the disease is irreversible. So I thank the researchers, they're doing their job, but when the time comes, when people think they've made enough money, they'll probably release. Because there's one drug, one disease that they haven't got a drug in spite of so much research going on for over 22 years. So I can't believe that. It's just that, the commercial value and all is there. So I thank all these people, and more importantly, young people like you all. I like to see everyone's face. One is I know that I'm not getting boring, so I can continue. Or to just see, because it's new thought, and please ask the questions. I may not go typically on the PPT done, because lots, I'm sort of bubbling with things that I have to answer, So we'll go to that. And our daycare center called Universe of Memory, Smriti Vishwam, got the ISO recognition within 4 months of our starting, because they were so happy they were doing that. And today we're going to do Alzheimer's disease, healthy aging and risk reduction, which he's done, but I'll do another aspect of it, especially with COVID and all coming in. So we know that old age brings diseases, comorbidities, a lot of problems of diabetes, blood pressure, kidney, heart, osteoporosis, knee problems. So these are all very, very common. And what are the factors that influence it? It is basically family history, the DNA, the genetic factor. So all these things create a problem for persons aging. Then we have most importantly the environment that we have for the elderly people. Can you imagine the rush that there in the buses or the trains? How many stop by and give a seat? It's difficult. Okay? So, aging is, मी मधून मराठीमध्ये बोलेन, म्हणजे तुम्ही पण समजू शकाल. So, what is important is that we need to respect our elders, because what you throw out, you get back manifold. बरकत करो, सबका अच्छा हो जाएगा. मत करो, मिलेगा नहीं. एक याद रखना चाहिए that the skies are open. Manna is free to give. If you are ready to take, there's no one-way traffic. It's a two-way thing. You give and we get. So I think aging and seniors, aging population seniors is very important. Coming to the population with dementia, India, we have done a lot of, there's ongoing research. The numbers are around 6 million people. I feel that the number is not right, because this number is lack of people coming up saying that they have a family member with dementia. The problem is that the social stigma disallows people to actually accept that the person has dementia. So these figures are not correct, and we may not know the right figure. But the Lancet Global Burden Study says that it will reach up to 17 million by the year 2050. So we have a big challenge on hand. COVID has shown how much, infrastructure we have for general public health and least of all dementia. Being on the Maharashtra government panel, mental health panel, we're doing a lot. Maharashtra was the first state to have, all the 36 districts have memory clinics in every hospital twice a week. So I think Maharashtra is very, very active, and we are going. I mean, we are taking strides, if not giant steps. And we are now here. We come to the next slide. So aging brings a lot of slowing down, lot of problems, lack of confidence because there's dependency on other people. Even to cross the road is difficult, or maybe to go to the market, or things that they did on a usual easy basis, they find dependency. Then also because people have stopped working, bringing income. They were breadwinners in the home. They have stopped getting the income, so they think they're a piece of what, and they can be dispensed with. So I think once a person is retired and aging, we have to reassure them, भाई तनख्वाह नहीं घर में लेके आ रहे हैं, you're important to us, बुजुर्ग है, respect. So I think that reassurance of emotional, the psychological impact we can give is very, very important. And also, as I said, that what happens is, even in normal, if somebody is 35, 40, and the person is, got a lot of health problems, somebody with cancer or TB or HIV or whatever, can you imagine the mental state? It's not easy even for a young person. Also, what I'd like to tell is that apart from, I don't know whether before I came that they discussed about the types of dementia. Like Urvashi said, Dr. Shah said that you have an umbrella and there are a lot of diseases. There are over 100 types of dementia. Most common is Alzheimer's. 60 to 70% is with persons living with dementia or Alzheimer's. And memory loss is the main thing. But what the most important thing is personality change, switch. That is a giveaway. So you have to be alert in your family, in your society, relatives, whatever. Just be vigilant, because the earlier you diagnose, immediate intervention, there is hope for the person and more importantly the family. So here we are seeing that the person now, see, vulnerable elderly population you see is very, very high, the second largest globally. And then we expect the figures to rise to 13% by 25, and we are already, I'm sure we've reached there, but probably we don't have the right numbers. India doesn't have any data actual physically collected, because that's another thing we've suggested. In Bombay and Maharashtra we have a questionnaire. I was very keen that in the census questionnaire, as we have other health problems, we write even mental health. So it could be schizophrenia, it could be depression, it could be any, even Alzheimer's and dementia. So we have a database to fall back on and work accordingly. And of course, as I said, the figure expected is 17 million, and that is a rise by 21.3%. And now what has happened is that with the medication of comorbidities, the lifespan is getting more. So the old age dependency ratio, OADR, is much more on the youth, because we are having a heavy population, aging population, and lesser people. And if lesser youth is there, it's because there's mobility of younger people, and there is no enough people to do caregiving. So here we see that it's a need of an hour. The WHO calls it the diabetes. It's a third type of diabetes, and they say that the decade of healthy aging is 20 to 30. And in this time, the Indian government has done a wonderful thing of having the sustainable development goals, which falls in line with the decade of healthy aging. So we have to see that the quality of life is better. Now, what is healthy aging? What are the action areas according to the SDG? It says there are 4, and first thing is we have to change our mindset, how we accept aging and how we accept that person's age and what kind of diseases that come. We have to foster the abilities of older people. We have to concentrate on the haves rather than the have not, can rather than the cannot. So moment you are imbibing those positive energies, it's going to make a difference in the lives of people who are living with dementia. And also the primary, tertiary, secondary sectors are given enough backup for having access to Medicare and facilities for rehab. Maybe this next. So what is the need? I mean, we have to see that between 2010 and 15 and 50, the population of 60 is going to almost double from 12 to 24. And by this it means that each, by a certain time, there'll be an outnumbering of old age to youth. And here we see that 80% will be living in middle income and low income countries. Are we ready to handle them? No, we're not. We don't have the funds. So that's why we talk of having people, the corporates come and share the onus with the government. And we have to see that how COVID has also destroyed the lives of facilities available and how they've been struggling. But we did a marvelous job, I think, as much as one could, though they had a lot of volunteers and all. I think, the COVID phase was very well handled. So we come to the next, what is healthy aging? So the WHO defines it very properly, that the main thing is that you can handle yourself independently. That is what healthy aging is about. And here it says that as it's, declared as the decade of healthy aging, governments are called upon to give a commitment, which they have, and India has committed at the council meeting. Now here, how can we reduce the risk? They've already said it, but I'd like to say that first thing is physical activity, diet, social activity. The more you communicate, your psychology students, I think ventilation is important. Don't carry on your troubles. Don't sleep with them. Let it out, whether it's a person, who is known to you very well, a professional. The first thing is you talk to a friend, you talk to your family, if they are receptive, or the family is a problem, or you're giving the family a problem, so you can't go to the family. Just go, reach out, ask for help. Like last week I was giving a talk on suicide prevention, and I thought it was important to say that that's not the answer to problems. Talk, share your problems. A person on the street can give you advice and you take it. If the same thing came from your home, I think it would be ghar ki murgi. Okay? And then what is good for the heart is good for the brain. So if you eat right, your heart is good. They have connected diabetes and heart problem with dementia. So I think, like I tell people, if you're a foodie, close your mouth when you see food. If you can't close your mouth, you drink a lot of water. It's a very good thing. You lose weight, your skin gets better, So drink water at least half an hour before. Like in yoga, we believe that the stomach has got 4 parts. 50 should be water, 25 should be air, and 25 food. तो खाने के पहले 2 गिलास पानी पीना है, जिससे हमारा पूरा शरीर संयम में रहता है, उसकी क्षमता बढ़ती है और निजी जीवन में अपना काम सही सलामत होता है. So I think diet and water, drink a lot of water. Water in Japan, they say water is the blessing. Drink a lot of it, and it's free. I mean, Bisleri you pay, but it's not like you're going to a big restaurant, unless you're buying Bisleri in a restaurant where you get 10 rupee bottle for 80 rupees or whatever. Carry a bottle in your bag. So, and you mix with people. Social activity is important. So aging and health, we see that, there's mental, physical and psychosocial. You know that better than I do. So therefore, working for healthy aging involves people, and that's you and me, and we work together. So what is, I believe in an environment. Uh, you would like to go into a crowded room that has no AC, or there are a lot of people smoking. Environment is very important, because when you enter a room, you should get the positive vibrations. You should be able to share your vibrations. Mentally, you should feel very happy, relaxed, leave the place in a better frame of mind. So I think environment is very important. And in this, we have to see there's diversity, there's inclusion, where nobody is not allowed to be in that space. So it's very healthy. Also, when we meet, respect, listen. I may not be right all the time. Maybe I'm wrong all the time. We have to accept that we have to learn and be open. So this is another thing, that you respect other people for what they are not, because we have a lot of nots also, so we don't go knotting. Okay. And then also we have to keep being flexible. Unless we are open, unless we are flexible, nothing's going to work. So go with the flow. Like in our center we say, don't push, go with their flow. So we don't have a timetable like a lot of old age homes have, 9 to 10, 10 to 11, 11 to 12. We just see the average mood of the group and we do accordingly. But we start the day with flexes and kind of yoga that is customized to their physical ability. So here we have somebody with doing gardening. Now we say, why are the spaces so important? We see that physical and mental health is improved upon, there is well-being, the quality of life is better. And when a person's living at home, if their life is better, obviously the family is going to be in a better frame of mind and accept that whatever the challenges are, they can handle. Then we have social and civic engagement. One, doing yourself is good enough, doing in a group is much, much better. Also, what happens is that when somebody is slowing down, they are embarrassed, they feel that they are not wanted, and they feel that व्यर्थ है जीवन, नहीं चाहिए, मुझे ये नहीं आता है, मैं कमाता नहीं हूँ या कमाती नहीं हूँ, जी के क्या फायदा है. नहीं. I believe that old people are a wealth. खान है, अनुभव की खान है, तो उनसे सीखना है. वय वाढता वाढता अनुभव इतके असतात की जे पुस्तकात नसतं ते माणूस माणसाकडनं शिकतो. So I think we have to respect that and learn from them. And also, when we talk of housing, safety and information, we've had a member of our center, but on a holiday got lost. Wife a doctor, husband used to be the head of VJTI in the department, and he was lost. It'll go to be 6 years now, he is not found. Very, very minimal cognition impairment, couldn't make out, but that was the time that he had to get lost and he was lost. And there's chaos. And one thing is, they complained but the cops didn't do anything. So 3 days and he was missed out. So we have the physical, like you see our young heroes, one going for a walk, the other one doing flexes. So environment plays an important role in healthy aging. It gives green space. Go into the garden, isn't it exciting? Smell the earth after the rain, or the gardener has put water in summer. So enjoy the flowers, the color. I think the air, Mother Nature is very, very generous, unconditionally generous. So we see the environment having, like the cosmos has the 5 elements, and that's in our body. You have the earth, you have the water, the fire, the air, the cosmos, all in your body. Like all the chakras are represented, the kainat, the Brahmand, the elements of nature. And if you identify that body, your own body, as a part of the cosmos, you immediately come to say that, okay, I'm part of the super soul. So you will not miss out on anything that nature is providing us, and we will live a life of good quality, not for ourselves, but putting others first. I'd done a presentation for a psycho department, and in the nursing department of JJ Hospital, where I entitled my PPT called I Do Care. Okay? And I had 3 series on that after that, because we went on, they said, no, we need it. And this time when they called, I said, don't you dare ask me for I don't care. You know? So I think it's how your mindset is. And being psychologists, I think you have to work on your own mindset first to accept another's and also see that the impact of others' challenges don't affect your own. Then, walking and obesity can come also because of glandular problems, not necessarily only of eating, or it could be hereditary. And then we have this, staying fit is also very important. So here we see the healthy spaces. What do? They can go out, they can go to the park, they can have conversation, gossip. And I have to say this, that men gossip more than women. They always say women gossip. No, men gossip more. Only thing is they do it very silently and discreetly. So, all you there, I know you gossip. And then you have social clubs, and here there's the intergenerational bond. I think it's very, very vital because each one aging loves to go back to their own time. They love to reminisce. And what better than to reminisce with your own grandchild or your neighbor's child? And I think you revive those memories, it's impactful for cognition. And I think we do a lot of intergenerational bonding. And once our center reopens, I'll be happy to have them come in groups and join the Purple Citizen Brigade. So that's what we do. We go on camps. We take them. We had an aware-a-thon on Sunday, in the Mumbai University campus, and we had about 500 people that included students. And we keep doing events. So the next one, I'm going to keep you in touch and keep in touch with you and let you know. But we have every quarterly almost we have public events. We'll be happy to have you there. And okay, the youth, now we come to a memory karaoke. This is a project I worked for 2.5 years on, and my board said, oh, nothing's going to come out of it. And sometimes, you go on your inner being. And I said, no, I'll take 5 years also, but I'm going to work on it. So this is a memory karaoke. I'll send you the link of that. I've forgotten to put this. So this is a karaoke that is customized for caregivers to, reinforce and remind the person living with dementia how with music you can remember. So now what happens is, like, this gentleman got lost, and I was thinking a man who was talking very correctly didn't know what was happening, and he got lost. He could remember his address, his name, what he was working with. That day was not just his day. So we said, okay, with the music we will make a app. And it was so good. I mean, I hate to be immodest, but I'll say it was good that MTV took it up. And we had a lot of hits. And that is the one I got an award for, the Indian Academy of Neurology. So now we're working on more things. And I do a lot of therapies for persons, elderly aging. We have groups, we do music and dance and puppetry, yoga, Pilates, painting, craft, and gardening. So it's just every time something new, and that, as I told you, click the bubble wrap one, and sand therapy and all. So this was that was an interview of on the thing. And then we also have to remember that Alzheimer's doesn't have a cure so far. Hopefully it will come when the wisdom of the Lord prevails. And then we have to, what we do is we go into the medical history of the person, the individual person, and how we can work on it with them. Also, that we have to realize that it is a very, very challenging journey which has a lot of pain, a lot of hurt, especially if it's a primary family caregiver. So I'll just tell you briefly about the caregiving. There are two types of caregivers. One is primary, who is a family member, unpaid, taken for granted, treated like four-letter word, starting with S, not worth it. And the other one is a professional caregiver, maybe sensitive, probably had a family member who was old and passed away, realized much later that, oh, probably my mother had Alzheimer's, and oh God, so going overboard to help. But I think the most important thing is believe and remember that it could happen to anyone, Give of yourself, make your outreach so much, forget yourself. Just drown yourself in that commitment. Whatever commitment you choose in life, whatever profession you take, just think of that first. Only then will you succeed. We were talking of lifestyle earlier and caregiver stress. Now, there are two types of stress. One is how the caregiver feels, and the other is how the person living with dementia. So, the person living with dementia goes through the same pain: fear, psychosis, uh, sadness for being dependent on someone else when the person was ruling the roost at one point of time, and not knowing what is happening. Like, I have had people come and say, मुझे ना कुछ हो रहा है, पता नहीं है क्या हो रहा है, मालूम नहीं मेरे को, क्या नहीं. They can't get the word yaddash, they cannot say memory, they cannot say, words are not coming. So they are at bay, they are at loss of thought expression. So these people, we use more non-verbal language. Okay, sometimes they get irritated because they don't want somebody touching. Like, we had a Jain family member, wonderful, and the lady was worried. She said, we are living in one building and the whole family, joint family, stays together. And I said, what do you do on weekend? So, no, do you go out? No, we all meet. Then I found out that 200 plus in the same building. And the family was so large that they would meet on their own, no social activity. So she said, "Amara ladies sa baat nahi kare." So I said, don't worry, we'll look after him. And it was surprising that the first day, the gentleman stayed through the day. And the wife said that, I'm keeping the driver here. If he gets upset, you send him. He wasn't talking much, but he was comfortable. He had his food. We have Jain food also for persons who are, having the dietary restriction. He had the food. He played games. He played carom. And the wife would call me, "Kem che? Sahib kem che?" I said, "Barabar che." Then at 4 o'clock she said, "He's not asked for me." I said, "Sorry, Ben, nahi puchyo." So I said, be happy that he's 78 and you're 72 and he's not asked about you. But if he had asked about somebody else when he was younger, what would you have done? So at least be happy that he's comfortable. Surprisingly, the next day he was ready earlier to come to the center. That means we were on the right track. He just passed away a year and a half ago. But we all met him. It was funny how you meet people and they're gone the next month or something. So I think we have to be sensitive to them, empathetic. And what are the, I think somebody asked what are the skills or nature that a caregiver has. I think the first thing is empathy. Unless you have empathy, you will not be patient. So you have empathy, then you have patience, then it has to be sustained by compassion. You have to have compassion, and when you have all these three together, you are creating love between you and the bond to be established between the person needing your care. So it's like, you care for the caregiver, you care for the cared, and then you care for yourself. But just a small thought. In the airplane, what do they say? Put your mask on first and then help. So it is as important for the caregiver to look after themselves. They burn out very fast. It is not an easy job. They sacrifice their own life, they sacrifice their career. If it's not a family member, then they are sacrificing their time with their own family. So we always say, like, suppose somebody wants a caregiver 24 hours, I say no, take 2 caregivers, 12 hours duty each, because one needs a break from the other. It's important to, anybody needs, just say no, 2, because it's physically and emotionally and mentally impossible for somebody to look after them 24 hours. We don't have a problem because we are a group, we are like a family, it's more fun. We have students coming. Anybody plays music here? What do you play?
I play the piano.
Piano? Do you play the regular grand piano or the...
No, just the keyboard.
Okay. Anybody sings here? You do? What do you play? Harmonium. Harmonica or harmonium? Harmonium. Anybody sings here? What kind of music do you sing? Classical? Classical. Very good. So you know we have sessions. We have the school, the Whistling Woods International School. Their students come. We have cafes, where we go. We sit down. We've taken them for, like, one of the gentlemen. He said, मैं जब एक यंग था ना, I said, अंकल आप तो यंग है, हम बूढ़े हो गए, मेरे बाल सफेद है. Says, नहीं नहीं नहीं, आप तो जवान है, मैं ही बूढ़ा हो गया, मैं इतना स्लो हूँ, आप तो भागते हैं. I said, नहीं नहीं, वो मैं बताती हूँ कि बाद में मैं भाग नहीं सकती. This person, he said that when he was young, मेरा first girlfriend था ना, कितने थे सारे? काफी थे, So I said, आप तो हीरो होते होंगे ना? नहीं, तभी मैं जवान था और बहुत हैंडसम था. And he was a photographer for the Bollywood. So you asked him, who is your best Gujarati guy? Asha Parekh. Who is your best hero? Sanjeev Kumar. I said, सब गुजराती को क्यों पकड़ते हैं आप? कोई और बोलो. अच्छा ठीक है, शमी कपूर भी अच्छा है, And he was the one who had stopped using the phone. I mean the camera. So his wife said, "Leta j nathi camera, su kara." And he was one of the finest photographers. So I said, "Don't worry, we'll try and manage." So our first event was there, somebody's birthday, and our hero comes with the small camera in his pocket. Nobody in the house knows. And a cake was kept, the food was kept, and suddenly this man shuffles in his pocket. What does he do? He takes out his camera. And I was sitting next to his wife and I said, "Just see, your husband was taking out a photograph." She said, "Where did he get the camera from?" I said, "Let him be." He took out phenomenal pictures, okay? So we saw it and then I said, I want to learn photography. I don't know how to use. He looked at me. You want to learn photography? ये देखा है? खाली एक बटन दबाने का और फोटो आया. ऐसा कैसे होता है कैमरा? He said, हमारे जमाने में एकदम प्रोफेशनल था. This is a डब्बा, like, so प्रोफेशनल था. लेंस एडजस्ट करना है. अभी तो ये सब इंस्टेंट है. So they had the thought process. Mood swings are there, so it's not necessary that they cannot express. They have mood swings when they're in a good mood or they're communicable mood, they will talk. If they lose the power of words and expression, prompt them. There's nothing like, "Oh, you're there for me, you're there to support." So I think it's important that we have to do this. So he's the one who talked about, I took my first girlfriend to K. Rustam's. So I said, "K. Rustam?" He's saying, "वो CCI के पास में एक आइसक्रीम है ना." Now we have to make them talk, right? So किधर है वो? नहीं, वो ऐसा ग्राउंड फ्लोर पे है and all. उधर ना मस्त एकदम सैंडविच मिलता है. I said, "अच्छा वो भैया देते हैं?" नहीं, ये आइसक्रीम है. So he explained to me the whole thing. And मेरे को स्ट्रॉबेरी बहुत अच्छा लगता था. लेकिन सीजन में मैंगो भी आता है. ऐसा अच्छा. So the next day we said, "Okay, we'll hire 2 vans and take them." So we told the guy to cut it in half because they're not supposed to eat sweet. And then immediately I told the families, tomorrow is this thing, so don't give them any sweet at home. And we took them, they had their bibs because they spoiled their clothes. Fantastic, they had a good time. Abhi वापिस कभी आने का इधर? Okay, another example was another gentleman. He comes on first thing in the morning on Saturday, and he says, "ये CCD क्या है?" So I said, पता नहीं क्या है. क्यों? So he said, नहीं, हमारा granddaughter है ना, वो every Friday evening she goes to CCD. I said, CD या CCD? No, CCD. और mood अच्छा होता है. I said, okay, we'll find out. So the next week, I think it was a Saturday he said that. So Monday, I got, I went to one of the CCDs and I said, this is the problem. Could you, as an exception, have the cafe open from 9 to 12? Because 12 o'clock their business starts. And we like to book it and don't let anyone come unless. So we booked it. So I thought, chalo, 9 o'clock we'll go, and 10:30 they'll get fed up. But the staff was so excited about them, very happy, tabla, bibla, singing. You won't believe it, more cookies started coming. And I said, we've not ordered for them. No auntie, no ma'am, we're giving it to them. I said, they're not supposed to eat, they're supposed to have food at the center. एक प्लेट और लाओ, ये लाओ, वो लाओ. So I said, when they say say abhi diya hai karke, because they don't remember. Then comes 12 o'clock, and my watch, my mind was on the watch. So I said, oh my god, 12 o'clock, 10 minutes to go. And they're the kind of people, you have to sort of scrape them from where they are to get up. So I said, oh, we have to go back. किधर स्कूल में जाने का वापस क्यों जाने का, आज छुट्टी है. Because some of them called it school, some of them club, some of them दूसरा घर है ना, हम उधर जाएंगे. So eventually at 12:20 we actually got them out. Okay, we come out to the steps of going down, and what do they say? अभी कल सुबह कितने बजे आने का इधर? So you know, the whole point I'm trying to share with you is, it's the love of life. They are alive inside. They need care. They need us. They need us to love unconditionally. And believe me, when you love unconditionally, there's definitely going to be a response on them, a positive impact, and it's going to help them. So you know, the whole outset is, plan your life. Whatever you do, make goals, have big dreams. Unless you have big dreams, I dream, I can do this. I work towards it. So moment you start dreaming big, at least I assure you, if at my age I can achieve 90% of my dreams, I'm sure you'll have 110%. You'll not only achieve what you've dreamt and worked on, but you'll get new things to go next. Please do that. You've got a great career ahead, good life ahead, live well, because I think, you know, the sad thing is that now, earlier we used to have cases of dementia with those over 60, 65 years, and it was very common, like, you know, people having health problems, going into dementia. But now with, you know, bad lifestyle, alcoholism, HIV, drugs, 38 plus, 38 is the youngest patient I have. So, you know, it's very, very important that if you have a lifestyle that is not very nice, remember 20 years down the line, you'll be in problems, and maybe 30 years down the line, you'll be in bed not knowing anything around you. Next is, during COVID, what happened? COVID was very, very sad because it upset the elder population, it upset the young kids who couldn't play, you know, in the compound or go to school, meet their friends. So what we did was, we had you know, home care service, so that they wouldn't lose touch, or they would not get into depression or isolate themselves. So what we did was, still, you know, we got the municipal and government cards ready. We started sending them surprise packages. So once in 3 weeks, we would send them a basket with all the petrol that they enjoyed in the daycare. So somebody liked farsan, somebody liked, you know, wafers or chips or whatever, and that's what we packed. We packed them toys, games, and craft material. So we started online therapy. Now, the whole thing is, we say that people with dementia don't have focus, they don't concentrate. So main concern was, will they be able to attend online? But I'm, you know, very happy to tell you that it was strange that they learned to focus on the screen within 2 weeks. The only beautiful thing was that they didn't realize that it's a screen. So when I'd say, Mummy, kem cho? You know, and I'd go, they'd come close to the screen and give a kiss. They said, kya cho tame? Dekhata nathi. So I'd say, no. I said, a screen che. Acha, acha. They learn to use the phone. They learn to look at the phone, and then they say, aak bade che. Ye kya hai, chotu motu nahi hai, nahi chahiye. So we started doing online, and once they allowed for travel, we started having home care for them, which was much a relief to the people in the family. Because see, it's not easy for 24 hours somebody to be there. Kitna baja hai, khana ye kyun nahi? And another thing was, they were very fumbled because children didn't go to school, children go to work. So they were thinking, is it the children not going to school because fees can't be paid, because the father has lost his job, and they couldn't talk, so they couldn't ask, and all this thought process was going on. So we had to tell them, no, it's holiday. Like our center, they said, kabhi school ko kabhi khulne wala hai. So I said, no, repairing chalu hai. So it went on for 2 years. They said, kaun sa contractor ho gaya? Contractor cancel karo. Ye 2 saal kitna hota hai, you know, because they'd say at home, na, 2 years. So we have that kind of a thing. We started doing music. Every festival we would have we would celebrate. So I think 2019, we had Ganpati and we had the ready-made clay, to make the Ganpati. So now clay तो मिलने वाला नहीं है, क्या करना है? तो गेहूं का आटा का clay बनाया, and they made Ganpatis of गेहूं का आटा. They were so happy, and they first thing they did was when they made the Ganpati, first thing. So they have that sense, the old sense they've lived with, and they continue. So we have to cash in on what is possible from our side, and this doesn't cost money. To be at home, it doesn't cost money. So whatever you do positively, you help not only them, but more importantly, you help yourself. You grow within, you reach the super soul. I think, people go to places of worship, spend money on whatever. I think respect your elders. Matru Deva Bhava, Pitru Deva Bhava, Atiti Deva Bhava. We are Atiti, we are only Atiti. Zameen pe hum Atiti hoke aaye hain. तो अपना भी जीवन का कॉन्ट्रैक्ट है, इतना साल का है, करो और जाओ. People will not remember what you've gained or the status. No, what you have left behind as legacy is going to be followed, and I feel all of us should be trailblazers in our own way, and let us leave a mark in the lives of others. Okay, so all these things improve well-being, and how do we do it? Being interactive, sharing, caring, sharing to care and caring to share. That's very important. Giving without remembering, taking without forgetting. So these are very important things. Keep on learning. I think the best trump card, is learn. You can learn anything. Learn something new. Learn an instrument, learn a language, take a new course of study. मोटर चलने दो. जितना मोटर चलेगा, कॉग्निशन ठीक रहेगा, बेहतर रहेगा. Keep on learning and then connecting. Connect yourselves. Phone, hand clasp. This also enough. ये जो करते हैं ना, it is more than 1,000 words. The person receiving and the giver understands the communication. Who are we? So this is the way we enhance well-being. Then we go on to quality of life. When the well-being is improved, quality of life improves because you're focused, your concentration, your goals get better, you streamline your life, you do things that are worth the while, and most importantly, I think our health, whether it's physical or mental, it improves. So I think improved well-being and quality of life is very important. 2 minutes and I'll close because I'm watching the clock also. Okay, so this is our family with dementia. So we have this, top left, she's 90, now she's 97. When she came to us, she was 92. The first picture was when the other lady, she said, "Are you coming tomorrow?" So the old lady said, "You're asking me, are you coming tomorrow? Who are you to ask me?" She said, "No, I was happy spending time with you today." So this was the first evening when she was going home. And then you have, they play carom. Now she was a seamstress. She taught stitching for 68 years. And that was her source. So we got a machine for her. She was teaching. Every day one was a bakra of a student. Seekhne ka hai. So one of us would stand, she would relate, and that's how the day was spent. She knew nothing but stitching. And so likewise, we had children coming over. The bottom left, she was a professional artist. So every month we used to have her come and do a workshop for people. Okay, you color this, you color that. And she was normal at that time. Other times, switched off. So we say look out for healthy spaces to give health to others, keep growing yourself, feel young, believe that you can, make others believe that you can, they can, stay fit. Unless you're fit, they are not going to be fit. Active, be healthy, happy, and eventually live well. And what do? Eat bananas, as he said. So can we all stand and we can read the pledge, please? Hand on your heart. Okay, with a hand on our heart, let us read together. I will treat persons, read aloud. I will treat persons with Alzheimer's disease and dementia, other mental health issues and non-communicable diseases with dignity and respect. I will support them by understanding with empathy and compassion and manage them with patience. I will also be sensitive to their families and caregivers as they need us too. I request each one of us to join hands to engage in working for their empowerment and make the entire community dementia friendly. Today and every day, knowing that every 3 seconds someone in the world is developing dementia, let us spread the message. Remember those who cannot remember. Thank you so much. I think that one message we take home is remember those who cannot remember. So this is the contact. You can always go on the Facebook and see. And if there are any questions, welcome to. I did a lot of talking. So it's just that the public to share things, and I think the hands-on experience is reflected. Any questions, please?
So I am guessing, since you've been so long in the field,
You have to talk a bit loudly.
Stand up and ask.
since you've been so long in the field on working with people with dementia and Alzheimer's, I am guessing you've witnessed a lot of deaths as well, because you're obviously dealing with old people. So as someone who has experienced that, how do you get out of that? Because you eventually create bonds with those people because you're helping them out.
So how do you?
How do you deal with death?
See, death is inevitable, whether with dementia or not. I think you have to be passionate but detached. You do it for the joy of doing, knowing that maximum 15 years, 20 years, it's difficult. But you know when the time is coming and they cannot go on. So I think it's self-control. For this, I believe yoga is best. I'm passionate about yoga. So I think you maintain your balance and you're sensitive but not sentimental. Yeah? It's difficult. I mean, even if a person is normal and they go on, what do you do? But then you know that you've given the best you can to that person.
Hi, ma'am. My very close cousins, their grandmother has Alzheimer's, and unfortunately, she's in her last stages of Alzheimer's.
Sorry to
They are the primary caregivers of the house because they have a very tight family tradition, so they don't really believe in reaching out to a secondary family caregiver. But what has happened is that she was a single mother for a long time, so she has grown the family. But what's happening, I can see, they don't speak much about it, right? But what's happening is that day by day, they are seeing their mother
waste away.
And so when I speak to my aunt, there's a lot of sorrow in her eyes. There is the feel of, contribution, like they're there for their mother. But at the same time, she's a husk of who she was. So what I really want to ask is, how do we deal with the person you've known for 50 years of your life just suddenly be the parent to them, and it's working, and deal with what's to come and what is happening? How would we go?
See, the first thing is you have to be there for the person, okay? You don't let them retain. Let them talk it out. It's therapeutic for them. Be there, and like your aunt will be sitting with your grandmother, right? Be together. Because even if the grandmother is not conscious, she's comatose, or she's not willing to express herself, remember that the last thing that goes off a person is music. And you've seen people who are in coma or very, very sick and dying, they have tears coming out of their eyes. They can hear, they are alive inside. So let us live that moment of life for both, but together. Because since your aunt has been a primary caregiver, that bond will be very difficult. And when her mother moves on, I think you all have to sort of cloister around her and be there. And it's a matter of time, no? It's a matter of time. Okay? Yes.
one has an interest in this research area, then one may get disencouraged because of this. Then how can we tackle that? How can we tackle like?
See, there's no discouragement. Pure researchers and academicians will go in spite of brickbats. Okay, the work is going to go on. It's only acceptance by the medical fraternity and the pharma lobby. People are not going to stop. I mean, like if you're told don't do this and that's your passion, I won't stop doing what I want to do. In fact, I'm doing research which is a very new virgin territory. People laughed at me and all. I said, to hell. I mean, I don't talk. But the thing is, a person who's passionate about research for the betterment of society, I don't think will give up. And I believe one thing, the universe is very, very large. If there are 10 to say no, there'll be 20 created. The maker is very kind. And I'm a very strong believer, so something will come up. Okay, thank you.
Prior to TNECS, by specializing in neuropsychology at the University of Bristol, UK, she was associated in researching the genetic basis of early onset of Alzheimer's disease and its manifestations in association with the Avon longitudinal studies of parents and children. She is the recipient of many awards, including Mayor of Mumbai Award, Digital Women Award for Disruption, Most Inspiring Entrepreneur, etc. We now call upon Ms. Tanya Tanvi Malia to the podium to enlighten us.
Hi, thank you so much. I am often called as Tanya. That's perfectly fine. I'm Tanvi. I hold a master's in neuropsychology from the University of Bristol, and I have been working in this space of older adults, their mental and cognitive health since 2013, I think, soon after I graduated, 2012. I started my organization in 2014, and since then my team and I have been working with families across. I don't have any slides to show you. I do have a movie, however, that I want you to see. And before we begin, I would like to do an exercise with all of you. Through my talk today, if you feel that there are elements that have been covered in other talks, please do highlight it, and I'll stop right there. And I'll give you more information about things. Now, before we move forward, I would like all of you to close your eyes. And all of you have to be really good at imagining, okay? This is what we're going to do. I want you to close your eyes, take a deep breath, okay? Now, imagine that you are an individual and who's held a very important position in their career, okay? It's been a few years since you retired, okay? You are sitting somewhere and suddenly you are not sure of where you are. You want to really go home because where you are does not feel like your home anymore. Okay, there are some people in this surrounding that you somewhat recognize, but when you try to tell them that this is not your home, जब आप उनको कहने की कोशिश करते कि ये आपका घर नहीं है, they tell you that नहीं यही आपका घर है, आप यहीं पे रह रहे हैं, आपको यहीं रहना है. However, you don't recognize this place as your home. When they tell you that this is your son, you don't think that from what you are aware of, that is not your son. Your son is a lot younger. Your son is probably in school, and this individual is all of 40 years of age, 50 years of age, right? Now, in this moment, I want you to imagine and I want you to feel everything that you've been feeling. Imagine being this person, imagine having had the power that you've had, the success that you've had in your career, and today people telling you that you don't recognize your own son, this is your own son, this is your own house, when it does not match with the information in your brain. Now, I want you to slowly open your eyes, okay? And this is where I'm going to need some volunteers. What are some of the emotions that will come through when you go through this? Yes. A lot of anxiety, yes.
Fear.
Fear. Correct.
Confusion.
Correct. Absolutely. Any more? Yes. Absolutely. And when this happens to you over a long period of time, yes, I see somebody in the back.
Curiosity.
Curiosity. Yes. So you're absolutely spot on, right? With anxiety, helplessness, restlessness, vulnerability, all of this is what we see. Now, when you Google dementia, you Google what are the early starting signs of dementia, you will see 5 or 10 standard cliche answers. First will be loss of memory. Okay, it is almost as if an individual does not evidently display a loss of memory, they will never be even tested for dementia. They will never be diagnosed for dementia. Okay, and that is where the issue with diagnosis is. That is where it's not, the issue does not rest necessarily with the practitioners. It is in the society. It's a systemic issue. Until we evidently see that our loved one is starting to forget me, my mother or my grandmother is starting to forget me, I will not think that there is an issue, right? But this comes in much later in the disorder. So imagine, for a very long time this disorder has been manifesting and growing on its own and you have no idea, right? Till you reach the doctor, till you seek even your first consult with a neurologist, it is already that late in the disease. Okay, today what does science say? When do we start displaying signs? What is the progression of the disease? Before we go on to that, I would like to show you a small film because it will get a little technical eventually. Would you be able to play it? Thank you. You'll have to start it again if you were unable to see it.
association with?
Happy faces often make us forget about the silent battles raging behind them. The power of human connection is immense, but sometimes insufficient, just by itself, to ease struggles of the mind. Conversations about the mental health of our seemingly healthy parents and grandparents are incredibly important for their future.
Thank you. Well, I hope you all liked it. This is something that we did in the lockdown because we had so much time on our hands. Any thoughts, any themes that stood out for y'all through this? Did y'all see any, I don't want to say disorders, but did y'all see any symptoms? Did y'all see any mental health themes across this? Any volunteers to answer? Okay. Cool. I shall then tell you all. So, the story tracked 3 protagonists, right? So, one of them, as you see, it appears to be the lady, appears to be looking at pictures. You know, what we were trying to show is that she's dealing with loss, as most people in that age group are. You know, with the other individual who was like the most active, you know, who was drawing and painting at some point, who was reading a book, you know, you see that there is a constant shift in activities, you know, there is some restlessness there. That's also something that we were trying to highlight. In the third individual, who also happens to be my father in real life, you see that there are post-its everywhere, right? He's making lengthy lists of everything. He forgets to switch the gas off, which is not a symptom, like if once in a while it happens to all of us. But the point is that you see that there is some struggle with remembering certain things, but the individual is still smart and capable enough to cope with it. Okay? Does not mean that there are no difficulties. Now, as future therapists, practitioners, people in the field, this is the nuance that you will have to be aware of, right? That is the individual at the starting, in the very beginning, are they starting to have difficulties? You know, they may not match up to the clinical standard of a lot of our tests today. But do you see your grandparent, do you see your client starting to find certain things more difficult than before? And that is a good heuristic to see if this individual perhaps is not aging normally, right? हमारा इशू क्या है कि बहुत बार जब छोटी छोटी चीजें शुरुआत में होने लगती है तो हम उसको नॉर्मल पार्ट ऑफ एजिंग कह के डिसमिस कर देते हैं। जैसे इंसान जब भी शुरुआत में छोटी छोटी चीजें भूलने लगता है तो हमको लगता है कि अभी तो उम्र हो गई है, ये तो होना ही है, यू नो। बट उस वक्त अगर हम जाके न्यूरोलॉजिस्ट से मिले, हम अपने ब्रेन स्कैन्स करवाए, हम पता करें, इन्वेस्टिगेट करें ठीक से कि हमें ये नॉर्मल पार्ट ऑफ एजिंग है या कुछ और है, तो ये करना बहुत जरूरी है। हम बहुत बार ये नहीं करते, हम तब तक रुकते हैं जब इंसान अपने रिश्तेदारों को भूल जाता है और तब तक मेडिसिन के लिए काम करना, थेरेपी के लिए काम करना थोड़ा लिमिटेड होता है. What we can do, what medicines can do, what therapy can do becomes very limited. So with that, I would like to highlight, as also was a part of the topic that I was supposed to speak to you all about, what is the normal part of aging, what is the difference between normal part of aging and the initial signs of dementia. Now dementia is an umbrella term, okay? It's like saying somebody has a cold, okay? But why does that person have a cold? Is it because of COVID? Is it because of pneumonia? Is it H1N1? Right? So a person having a cold tells you nothing. Similarly, somebody having dementia, when you use the word that loosely, especially in the Indian context, it's used very loosely. What does it tell you about the individual and their diagnosis and what you're supposed to do, right? There are some things that we'll speak about when we come to the caregivers, even if that is what has been told to you. But as practitioners, first of all, as future practitioners, first of all, the first thing when you deal with anybody over the age of 50, right, very often the challenges that practitioners face is they may be engaging the person in traditional talk therapy. Okay, but you will see that traditional talk therapy is not helping the individual for a very long time, and you keep trying different techniques, you keep trying different modalities, it's still not helping. Well, systemically, what should ideally be is that everybody over the age of 50 should be getting regular checks to see if the disease has already begun in their brain. We call this a preclinical stage. Typically, before a lot of the symptoms manifest, भूलने से पहले, जब ये सारी चीजें शुरू होने से कम 10 से 15 साल पहले हमारे ब्रेन में चेंजेस शुरू हो जाते हैं, right? So imagine you have 10 to 15 year window where you can catch this in its earliest stage. 10 से 15 साल अगर पहले अगर आप ब्रेन स्कैन करते हैं तो शायद आप इस डिसीज को बहुत जल्दी पकड़ पाते हैं. इसमें in this preclinical window is where most medicines are most effective. It is where we can do a lot more therapeutically. Food will go a long distance, your exercise will go a long distance. It's not just therapy and food. We have to take a multi-dimensional 360-degree approach to that individual's life, not just now, but also planning ahead. So that is very important. In the Indian context, ये नहीं होता है. Unless somebody has a fall, a head injury, a stroke, brain scans कौन कराता है? We get blood tests regularly, but we don't get brain scans. And they shouldn't be done very regularly also. But one has to strike that balance and do that. So, while Google will tell you that memory loss, short-term memory being affected, difficulties with language, orientation, lack of orientation, issues with your executive functioning, these will all be symptoms that will be listed under dementia. But what do you see before, right? This is something that you will not find anywhere unless you speak to practitioners who also look at their work with insight, who are not just seeing one client after the other and thinking that, not really sitting and evaluating what are the observations that are coming across to them. Much before we see the fallout of the cognitive impairment, we start seeing everything that you all mentioned, right? We start seeing increased anxiety. We start seeing some amounts of depression. We start seeing restlessness. We start seeing helplessness. Because of which now helplessness manifests differently in people. Some people will become a little depressed, as one would say. Or for some people it will manifest in a more aggressive fashion, right? So we see heightened aggression. Now typically, even if the family is, looks at mental health from a destigmatized viewpoint, what happens is, they will still reach out to a therapist and say, my parent or my grandparent is showing signs of depression or anxiety, can you help? But as practitioners, as future practitioners, when you have such clients over the age of 50, it becomes very important for you to first analyze, why is this anxiety there? Is it a chronic anxiety issue that hasn't been resolved? Is it something that is just about come up? Or is it because the individual is starting to somewhere find it difficult cognitively to do certain things जिसकी वजह से anxiety हो रही है, जिसकी वजह से depression हो रहा है, जिसकी वजह से social withdrawal हो रहा है. while yes, like Dr. Shetty said that, you know, it's very important to have social interaction, it is very important to have friends. But now you think, if you are somebody who feels that I am forgetting my own name, I'm forgetting the names of faces and people, will you like to go into social situations? Because you will always be afraid that somebody will understand that you are going mad, right? That is how traditionally people with memory difficulties, with anything with respect to the brain, feel. Therefore, while yes, it is very important to socialize, it is also important to get these individuals to socialize in situations which are sensitive to their needs, right? Where people are not making them feel that they are forgetting, which is something that unfortunately a lot of our families end up doing because they are trying to help, where, you know, they understand that, okay, my grandparent has an issue with memory. So, you know, the classic thing that most families do is they will take them through albums and they'll say, ye kaun hai, ye kaun hai, ye kaun hai. Or they'll take them to, you know, parties or social events and be like, oh, you remember her, she did this, she was here. Now, this is an individual who you are very evidently आप उनको बता रहे हैं और दुनिया को भी बता रहे हैं कि इनको याद नहीं रहती चीजें, right? That is not emotionally easy for anybody. Not for us, not for somebody else, especially somebody who's already struggling with this, right? Imagine what it does to their sense of self and dignity, okay? And this is the topmost reason why most people with dementia in the early stages or the mid stages will start withdrawing socially, will stop hanging out with their friends, okay? So these are signs that if you ever happen to step into this field, work with people, these are signs that you should be aware of. Whenever you see that somebody that you're working with or somebody in your family or friends is, you know, starting to display these signs, it is extremely important that you immediately refer them for investigations, right? Send them to a neurologist, tell the family to get it checked. Zyada se zyada kya hoga, aapka shak galat hoga, and they will not have dementia. That's a risk that we can afford to take, right? But what if you are able to catch this in good time? There's so much that you can do for this individual, for this family. Now, I'm hoping that that has helped you understand the nuances between people with dementia and, you know, cognitively how it manifests. The other myth that I want to target is memory, right? Very often when we speak of dementia, we only think about memory issues, okay? Now, as I was saying before, if you have a cold, why do you have a cold? Is it because of COVID, pneumonia, H1N1, what is it? Similarly, if you have dementia, what is causing that dementia, right? Is it Alzheimer's? Is it vascular dementia? Is it frontotemporal dementia? There are different types of dementias. And each type, and I'm not going to go into details because it will take me 2 days or more to, you know, highlight all of this for you. But each type of dementia has differences in its symptoms. What you typically read about dementia is mostly about Alzheimer's, where you see that the person is repetitive, you know, so short-term memory impairment hai shayad, and things like that, which is what typically happens in Alzheimer's in the beginning. Eventually, the individual, the short-term memory impairment will also sort of start spreading over to their long-term memories, where the connections will start being impaired in their brain. They may be disoriented, you know, they may not remember what day, time, etc. it is. They may not remember that this is their house, especially if they've been shifted, you know, they've shifted houses recently. So all of this you will see. However, with something like a frontotemporal dementia, you may not see any changes or any impact on the memory at all, right? The frontotemporal dementia is what affects the frontal and the temporal areas of your brain, right? These are the areas of your brain that are responsible for behavior, that are responsible for personality, that are responsible for inhibition, that are responsible for language, okay? So, in this type of dementia, there are two variants. There is one where the inhibition goes down, okay? There are personality changes. We call this the behavioral variant. There's another one where the language is affected, okay? So, I'll give you an example. Once we had a client, memory apparently top-notch, okay, but it was difficult to test it. Language, however, very young. Language, however, they only had about 10 words in their vocabulary. Office, meeting, conference, secretary, and, you know, some 7 or 8 words. So even if they wanted to say that I want water, they would try saying a combination of these words to communicate that. They had lost language, right? So imagine the amount of anxiety that a person like this feels. कि वो कहना चाह रहे हैं पर उनके पास वो शब्द नहीं आ रहे, right? But again, this is not something that will be diagnosed. Similarly, we have worked with clients where, in social situations, inhibition has gone down. So we see aggression, we see, the person being rude suddenly, and things like that. Things that they would not say before, they are suddenly starting to say now. Memory, perfect, right? So initially, I'm talking about the initial days. Eventually, all cognitive, faculties will be impaired. But these are nuances that very often are missed. So if you see this as practitioners amongst people in your family, make sure that you refer the person to a neurologist to get them checked out. Okay. When it comes to caregivers, what do we do with caregivers? How do we train them? What are the techniques that they can employ? I think the first most important thing for any caregiver to do is acquaint themselves with the correct diagnosis. Okay, now this is as much as it is on caregivers, it is also on the practitioners. Very often in India, when people even manage to go to the practitioner, to a psychiatrist, to a neurologist, it is rather unfortunate, but there is a very unidirectional approach, where the family is almost dissuaded from going to other practitioners, right? तो जैसे बहुत बार ऐसे होता है that the doctor, even though they may be a neurologist, they may also prescribe some psychiatric medication. Okay. Now the family will think कि अभी तो psychiatrist के पास जाने की जरूरत नहीं है. In fact, the family is not even aware that you can go to a psychiatrist also. What is ideally a very well, put together situation? There is a neurologist, there is a geriatric psychiatrist, there is a therapist who is working with the family, and there is a therapist who is working with the individual, right? There is a physiotherapist if physical activity by themselves is not possible. There is a nutritionist, right? All of this, and then there are trained attendants. Okay, so all of this is put together, and this I am talking about somebody who does not have other comorbidities, right? What if an individual needs other doctors? They have diabetes, they have heart issues, then those doctors also have to be involved. आप एक डॉक्टर के पास जाके नहीं सोच सकते कि अच्छा अब तो ठीक हो जाएगा बस ये दवाई ले लो. That is not an approach that works. That is the approach, unfortunately, that our country has been taking, and it hasn't worked, right? But when you look at how this is dealt across places that are doing managing dementia well, you'll see that a 360-degree approach is what works best, because जिंदगी में आप सब important होता है ना, आपका खाना पीना, लोगों से बातचीत करना, आपका emotions, all of this is important. So आपको सब तरीके के डॉक्टर्स के पास जाके उनके स्पेशलाइजेशन से you have to understand and you have to gain. So that for us becomes the first technique with caregivers. That what are the doctors they're already consulting? In addition to that, what are the practitioners or specialists should they see, given the nature of what their loved one is going through. The second very important thing for us is to train caregivers with respect to their communication pattern. जैसे कि मैंने आपको एक छोटा सा example दिया, that when the individual starts forgetting, one of the first things that families start doing is, see, they are not trying to harm the individual, even emotionally. उनको लगता है कि जैसे आप बच्चे को 10 बार पूछते हैं कि ये कौन है, and 11 times they may remember, is the same thing that happens with dementia. लेकिन dementia में जो सेल के connections है वो weak हो रहे हैं. आप चाहे 50 बार पूछ लो, शायद याद रहेगा ही नहीं, लेकिन क्या होगा, you will end up, emotionally impacting that individual. Okay, so it is very important. And how do you maintain their memories, right? Because वो भी तो करना जरूरी है, आप छोड़ नहीं सकते. So how do you do that? How do you communicate with that individual such that उनकी dignity, उनका sense of self preserved रहेगा, right? So that is something that we teach, communication not just to the family members but also the different attendants that work with them. That's the sensitization training that we bring in. The other most important thing is also, like I said, directing them to different individuals. The third most important thing that we work with caregivers on is the routine, right? Because for somebody with dementia, the routine is very important. Having a structure is very, very important. जब भी उनके दिन में एक प्रिडिक्टेबिलिटी होती है कि सुबह उठ के 6 बजे वॉक पे जाते हैं, 7 बजे ये करते हैं, भले ही वो whatever their routine may be, they may be waking up at 10 a.m. It's fine, but their routine is their routine. As long as they are adhering to a routine, routine sort of helps bring in a sense of orientation. Even in the later stages, we notice that. Now, in addition to that, then we equip the caregivers with other things that they can incorporate. Will music help? Can we incorporate music into the routine to help them become better oriented? Also from a therapy perspective, is that something that will help? So all of these are different techniques. All of these are different areas that we work with caregivers on. And for me, that is it. So I will leave you all here. I am not sure if I overran my time or if there is enough time. Okay, if there are questions, however, please feel free to ask and I'll be happy to answer them. Any questions? Okay, alright, thank you so much. It was wonderful being here.
Well, just before the lunch, right? So I'm going to start with a story. So, about 10 years back, I was visiting one of my clients. She was an advocate, now retired. She was practicing in Calcutta for years. Then she moved to Dadar with her son. And let's call her Mrs. Shah. And I used to visit her, just to see what she's doing, do some activities with her. And she had early onset of dementia. So by now you all know what symptoms are there, right? So she used to forget where she was going, what she was doing. Then there was poor judgment. She couldn't communicate very well, but she was still conversing. What used to happen is she was staying with her son, daughter-in-law, and two young granddaughters. And they used to make fun of her because they were barely 6 and I think 10, just like how my kids are, really small, hardly understand anything. And when she was walking around, she would suddenly stop while they were watching the TV, and their view would be blocked. So they used to like, दादी आप पागल हो गए क्या? आपको याद नहीं रहता, इधर ही आप खड़े हो जाते हो, right? And this many times used to happen in front of me also. While I was aware kids did not mean that, they were only seeing her action, but they did not understand what she was going through. And it used to happen on and on to an extent other family members would also say. 10 years back, the awareness was very poor. Those who are professionals here working in the sector would know that, right? Now it's much better. So one day what happened, I was again visiting and the grandkids told her certain things, very mean things. And she got angry, right? Can you imagine a person with dementia getting angry? Because most of the time people imagine there are no emotions, okay? But there are. That's a topic for another day maybe. And she angrily said, देखो ये जो अमृता है ना, ये मेरी फ्रेंड है, वो मेरे लिए बहुत केयर करती है, आप मुझे कुछ बोलोगे ना, मैं उनके घर पे चली जाऊंगी. And that moment I felt that I was someone for her, right? I'm sure most of you here are professionals. Are there any caregivers? Most of you are, ma'am, okay. So otherwise they are professionals, right? So for me, even being there just for 2 hours in a week, it meant a lot to me that she felt it was much safer for her to come to my house, right? And that's the power of empathetic care. And that's what you all attending these seminars, very beautifully planned, very good, really great speakers, right? So I must congratulate all of you, the organizing team especially. So the empathetic care definitely is at the center stage when it comes to dementia care, right? Why I say so? So you always have to remember it's like a triangle. So in a triangle there are 3 points, right? So one point is actually the person who has dementia. Can you tell me which is the second point in the care system, I mean? Yes, very good. Family caregivers, yes. And there is third also. What would that be? Yeah, you're smiling. You know the answer. It's you all, professionals, right? And only when all 3 of us work together, so the person with dementia, their family caregivers, and the professional or whoever is involved in the care, they have to work together to improve quality of life for whom? Person with dementia and Caregiver, yes. Never ever forget caregiver. They are equally important in this system. In fact, we have seen a person with dementia most of the time is quite happy, except for certain episodes when they have bad behavioral symptoms or episodes. Otherwise, they are quite okay, but the caregivers suffer. Yeah, they are in fact by research are now labeled as caregivers as invisible patients of dementia, right? So they are not seen as patients, but they also suffer in the disease, right? That's one of the reasons since past 6 years regularly we have been running a support group free of cost only for family caregivers of dementia. It's not very far for you. It's in Holy Family Hospital. One of the senior psychiatrists, late Dr. Charles Minto, he thought of starting this support group because when he used to see patients, he realized that caregivers were suffering. They needed more support from us professionals in terms of guidance, sometimes just listening ear as well, right? Just to tell you like the empathetic care, why it is so important, there was another very interesting research that came out in UK. And so when I say 2 minutes, right, 2 minutes, what do you think of? What do you think of? I want really crazy answers. Maggie, yes, very standard answer I get every time. Anything else? Those who are sleeping, they need 2 minutes break. What else? Yeah. Yeah, I need 2 more minutes, right? Yeah. Done? Or anything else? Okay? So 2 minutes Maggie, 2 minutes break, 2 minutes more for something, I'll just come back in 2 minutes, etc. But it was actually quite disturbing research. So it was 2 minutes. They said that any resident of a care home, so they did this in UK, and not a small sample, 800 to 900 residents they had checked or had taken in a sample. 2 minutes of interaction is what they got in a day. Okay, social interaction. That also includes, I want to go to the bathroom, I want to eat food, I want to sleep. Everything included, 2 minutes of interaction is all they got in a day. How would you feel? Yeah, but that was the reality. They checked, they studied. And just after that, there was another research that a resident in a care home, all they needed was 1 hour of interaction in a week to improve their quality of life. That is how much per day, roughly? 1 hour in a week is what they needed to have a better life, better quality of life. 10 minutes? Yeah. So all they needed was 10 minutes of person-centered care. I'm sure someone must have covered that today. So talking about them, what they like, and that improved their quality of life. Now you see, we don't have care homes here, it's only home care. Trust me, situation is not any different even in India, right? So home care, yes, there are people living with their family, but not necessarily they are getting the interaction. That's one of the reasons psychologists like you, professionals like you could be trained to be a companion for these elderly, yeah. Why specifically we hire psychologists is because we also focus on therapy part of it. But there is also an aspect where other people, even social workers, caregivers who have been in the offering care, now they want to give back to the sector, they can be trained to offer companionship. Yeah. So that has become very effective way of interacting with seniors, especially with dementia. Working in this sector is also rewarding. What would you consider working in dementia care? Yeah. But what about young kids? There are young people. Not for the certificate, right, today? Of course not, right? So it's rewarding. There was interestingly again one research where they studied people who were working in the sector and they asked them how was their quality of life, professionals like you, and they realized people who work with people who have dementia or professionals, they also have improved outcome in terms of quality of life. Though most of my teammates do come back to me saying, listen, I met my relative yesterday. She asked me what I do. When I told her I work in the mental health sector, dementia care, and do you not get depressed? It was the first reaction. And she said, no, I really enjoy working with them. Okay. So training, this empowerment will help you tackle a lot of these difficult situations that even families struggle to understand many times. Fact is, professionals, outsiders are better accepted many times, those who are empathetic. That gives a respite to family caregivers as well. Yeah. People who have joined me, say 2 years back, 3 years back, as freshers, so they have completed their masters in clinical psychology, has joined us. In a year or two, they have progressed so much, they are training now. And not just internally, right? The bigger organization are calling them to talk about these things because there are very few professionals in the sector. So I give you guarantee, if you are looking at this, working at geriatric sector, there are huge opportunities. You will progress much quickly, and at the same time you will enjoy working. Yeah, and this is not, of course, a charity. You will be paid as well, right? And that's extremely important. That's where we come in. We make sure that our team is treated better, they are paid better, right? So there are a lot of different aspects to it. You can definitely consider working in this sector. Of course, you can have more in-depth training. Today was more like introduction, but I'm sure that you are much aware now that what more could be done for people who have dementia, not just limited to assessments. That's probably you will see once that person with dementia if you're doing assessment. But when you're actually providing support, it will be a much more meaningful interaction that will have impact on not just the person but the entire family as well. So this is what I wanted to cover. If you have any questions about the sector, you can ask me. So just to give you just quick idea, what we do is home visits, training for caregivers, counseling as well for caregivers, support group like I said, and training. So we have also got approval from government now to do training certificate programs for professionals, so psychologists like you, social workers, which will be launched very soon. Got approved in Alzheimer's month as well. So it will be a government certificate that you will get for this training, and you will have more opportunity to work in the sector as well. So yeah, this is what I wanted to say in 10-15 minutes I had. If you have any questions, feel free to ask. Just lunch? Okay, thank you.
Thank you so much, ma'am, for taking time out to be with us today and contribute a valuable insight and knowledge. It's true, ma'am, that we can help individuals with dementia collaborating with professionals as well as family caregivers themselves. Thank you so much for taking time out once again to be with us here today. We now call upon Kaushani Ghosh to give the token of appreciation. Worldwide, around 55 million people have dementia, with over 60% living in low and middle income countries. As the proportion of older people in the population is increasing in nearly every country, this number is expected to rise even more. There's a lot to think about after receiving a diagnosis of dementia. World Alzheimer's Month is a global opportunity to raise awareness around, educate, encourage support of, and demystify dementia. We fail to acknowledge that this entails a percentage of the population that may include us in the future.
It is our social right to instill values and mindsets that promote better lifestyles for them.
We hope that by this seminar we have spread our token of awareness and taken on our duty to enter the world as courageous, as inspiring, and as strong as our speakers here today. We are really grateful to each of our speakers to for taking out time out of their busy schedule. We would especially like to extend our gratitude to Avinash D'Souza for following the Department of Psychology and enabling us to collaborate with the D'Souza Foundation in spreading such an impactful message. It's always such a pleasure to be associated with CSSC as we have done in the past. We will miss inputs from Advocate Nirmala Sawant ma'am, but we are honored to have Dr. Sanjay Oja representing CSSC. We thank our audience here today for joining us as well. We hope that we leave today with a new message and vision to our society.
Can you call it again?